The House will come to order. Calendar for the day. The first bill on the calendar for the day is Senate File 3307. The clerk will report the bill.
Senate File number 3307, number 1 on the calendar for the day, an act relating to legislative enactments.
I recognize the member from Ramsey, the author of the bill, Representative Becker-Finn.
Thank you, Madam Speaker. This is the reviser's technical corrections bill, and then we have an amendment to actually put the corrections in the bill.
There is an amendment at the desk. The clerk will report the amendment.
Becker-Finn moves to amend Senate File number 3307. The amendment is coded A23-0166.
And there's an amendment to the amendment. The clerk will report the amendment.
Becker-Finn moves to amend her amendment to Senate File number 3307. The amendment to the amendment is coded A23-0185.
Representative Becker-Finn on the amendment to the amendment and to the extent you'd like on the underlying amendment.
You got it, Madam Speaker. Just as a reminder, these are technical corrections that have been signed off on by 2 members of the Senate and 2 members by the House, so Representative Scott and myself, as well as Senators Latz and Limmer. So these are purely technical and would appreciate member support.
The member from Anoka, Representative Scott.
Thank you, Speaker Hortman, Representative Becker-Finn. Yeah, isn't it nice on the last day to have something to just kumbaya over these really exciting technical provisions? But I encourage a green vote.
All those in favor of the amendment to the amendment, please say aye. Those opposed, please say no. The motion prevails. The amendment to the amendment is adopted. On the amendment as amended, all those in favor, please say aye. Those opposed, please say no. The motion prevails. The amendment to the amendment is adopted. There are no further amendments at the desk. The clerk will give the bill its third reading.
Third reading, Senate File number 3307, as amended.
Third reading as amended. Any further discussion to the bill? Seeing none, the clerk will take the roll on the bill. The clerk will close the roll. There being 132 ayes and 0 nays, the bill is passed as amended and its title agreed to. Members, at this point in time, we are waiting for the Senate to send us the Health and Children and Families budget. And in consultation with the minority leader, we have agreed to start discussion on the conference committee report of Senate File number 2995. The conference committee report is available online, and we have several hard copies here in the chamber. And we don't have the bill in front of us, so the clerk will not report the bill, but we will begin the discussion. I recognize the author of the bill, Representative Liebling, to explain the conference committee report.
Madam Speaker and members, thank you for allowing us to begin the discussion of the bill, even though we're not actually in possession of it here in the House right now. Appreciate the minority's cooperation in that. So I am here to talk about the conference report on Senate File 2995, which is this year's Health and Human Services bill, and also contains the Children and Families budget. So Chair Pinto and I had our very separate bills combined. Actually, there are some parts that aren't that separate. There's some sort of overlapping, confused jurisdiction. But we got it all sorted out. And we're very pleased to be here today to talk with you about this combined budget bill. which is large, but actually not as large as some Health and Human Services bills have been in my experience. I would like to start then with the thank yous, which are always, I know, maybe not that interesting to people who are listening, but very important to us. And first of all, I would like to thank my Senate partner, Chair Wiklund, and Chair Pinto, of course, for his partnership, my Vice Chair, Representative Bierman, and the other members of our conference committee as well, Representative Keeler and Representative Schumacher. We have amazing nonpartisan staff in this body who help us every step of the way. And I think it's so important to recognize them. We always do talk about them, but I want to say something a little bit special this time, and that is that we frequently ask our nonpartisan staff to do the impossible. We ask them to do the impossible. At the end of session, we ask them to work sometimes 24 hours or more in a row to get these bills processed. And this year is certainly no exception to that. And I must tell you, members, nobody should be asked to do that. Nobody. So I'm really not proud of us for that. And I'm really calling this out because we should not be doing it. And I hope in the future we can find ways to make this different. Because really no one should be asked to do it, but they do it and they don't complain about it. So or at least not much. So I would like to really thank our, on my side of the ledger at least, our fiscal staff, Joe Harney, and our nonpartisan House research, Randy Chun, Sarah Sunderman, Danielle Punelli, and Elizabeth Clarkvist, who did so much of the drafting on our side as well. And then I especially want to acknowledge the revisers staff who have just worked so hard for us. And I hope I don't mispronounce the name, but Dean Trefts, Alex Willie, and Sandy Glass-Serrani are the ones that I'm aware of, and I know there are others as well. They are amazing, and we thank them for their work. Of course, all of our amazing partisan staff, who I'm not going to name again right now, and the agency staff that works so closely with us. We have a wonderful new Commissioner of Health, Brooke Cunningham, who I hope many of you, if you haven't met her, will get to know. She has done really good work in coming into this really intense session as a new in that role. And then the Commissioner of Human Services, Jody Harpstead, and their wonderful staffs, who I won't name individually, but they know who they are. And then also I want to call out Sophie Wallerstedt, who was representing the governor's office and was just a really wonderful partner and helped to get this bill to come together. I don't think it really would have without her very able assistance. So let me then move to the actual bill and just talk a little bit about what is behind this bill. So we all know that healthcare in our healthcare system is so incredibly important. And many people would tell you that we have the best healthcare system in the world, and that may be true for some people. But the reality is still that for many people, healthcare is too expensive and may even be out of reach altogether. We have a very fractured healthcare system that does leave many people behind. So if you need care for mental health concerns or come from a minority community or are uninsured or speak a language other than English or are undocumented or many other things, you could very well be left behind. Our bill begins to address all of these things. It does improve mental health access through many provisions, including one from Representative Kraft on improving network adequacy, making sure that when you have insurance that it actually means you can get health care. There are many provisions to address equity throughout this bill, and most importantly, and it left the House the same way, it covers undocumented Minnesotans under Minnesota Care. It also sets us on a path toward a better, more equitable, and more efficient healthcare system. Health insurance, many of you know how I feel about health insurance. That's no secret. I don't think there are many people who actually really like having health insurance. They want health care. When they need it, they want to have it. And health insurance too often just puts a barrier between people and health care. We need to move away from that system and find a better path. And for the very first time in this bill, we are actually going to fund finding out what it will take to move toward a better system. And for that, I really thank Representative Ryer for her work, moving toward universal care, healthcare system. But before we can really solve the problem of the fractured health insurance system on the larger scale, I think we need to clean our own house, which to me means we should be deprivatizing our public programs so they can truly focus on the public interest. We had more on that when the bill left this body, and it's changed significantly in the conference report. We didn't get all the way there, but I'm very excited about what is in the bill because we're taking important steps forward by actually collecting data on the impacts of deprivatizing our public programs and putting in motion a plan to actually implement this change. And that is something we've never even gotten close to doing before. We are building up our state's ability to have eyes on the healthcare system in many ways. And we talked about this yesterday with Representative Bierman's other bill, but it's true in this bill as well. We are making changes so that we can do better in the future and have a better understanding of the impacts of those changes. For the very first time, we have the resources to get the answers we need to move forward. And no one should just think, oh, you know, it's kind of something we all talk about in the legislature. When we can't do something, we study it. It's kind of like the punt. But that's not what this is. This is serious resources and a serious analysis of some of the issues we need to understand better to actually move forward and make changes. Because healthcare is simply too important to just meddle in it and risk that people will not get what they need for their health and their lives. And so we're really taking a careful path, and we've designed systems and also beefed up our capabilities of our health department to continue doing more of this important work. We also know that health care is only one part of health. Of course, there are many other things, and you'll hear later from Chair Pinto and Representative Keeler about some of the other things that are important to health, namely being able to eat and have a place to lay your head, very important as well. But another thing that's really important is our public health system, and we certainly found that out during the pandemic. So one of the things that this bill does broadly is to build up our public health system and our emergency preparedness so that we are better positioned for the challenges of the future, which will come. Make no mistake about it. And this bill does more to address things like exposure to lead, to tobacco, and to other environmental dangers. There's a lot in this bill. I would keep you here for many, many hours just going through all the wonderful provisions in this bill. I couldn't be more excited about it. And I couldn't be more excited to have had so many wonderful partners, people giving input, members with provisions in the bill, and even those members who have given critiques of the provisions. I appreciate your input. So this bill is truly born of a commitment to our shared humanity. And thank you, Representative Ryer, for making that comment to me. It is so very true. And also, this bill is really about our belief that we all do better when all of us do better. Thank you, Madam Speaker.
The member from Dakota, Representative Bierman.
Thank you, Madam Speaker. Thank you, members. And let's just also start with thanking the committee, starting with Chair Liebling for her guidance and leadership on this committee. and also the members, all of them that we serve together with. And I look forward to having another year with everybody. We had excellent work and definitely people digging in on these issues and great conversations. So appreciate all the work of members. Members, this bill will save lives and expand access for Minnesotans to needed health care. As former Commissioner Malcolm often pointed out, providing needed access to health care for Minnesotans saves money, saves time, and saves lives. For many of our low-income elders, the disabled, those with special needs, expanded medical assistance coverage in several areas in this bill will be life-changing, because better health is life-changing. And starting with dental health, there is no health without dental health. And in this bill, we are reinstating a full adult benefit set for dental that was dropped in 2008, as was periodontal care in 2008, but we reinstated that last session. And so now we're taking the next step to take care of dental issues for people that unresolved result in nutrition issues and cardiovascular issues and heart issues. Treatment for these chronic conditions turns into higher costs and poorer health when they don't get the treatment, I should say. So in the long run, costs go down when we utilize prevention as policy. Pretty basic, but as we look at our healthcare system, we're missing the boat in a lot of these areas. So this bill will also eliminate cost sharing for MA, increasing that healthcare access for prevention. And tobacco cessation programs will also be included for MA eligible. In addition, MA coverage for recuperative care services. This will stabilize post-surgery and improve outcomes. And MA coverage for seizure detection devices. All of these issues, all of these needs that our MA folks need will be taken into account, and their outcomes will be better, and their chronic conditions will be less, and the costs will go down in the long term. So that's all a step forward. Another section of the bill addresses the growing mental health challenges we face. We have Representative Ryer's bill providing a rate increase for mental health services, Representative Vang's bill for mental health workforce grants, Representative Hassan's bill for cultural and ethnic minority infrastructure grants, and also the bill funds streamlining the CCBHC licensure and rates to facilitate treatment at 17 locations around the state. This is a newer project that the federal government helped launch in this state, and we are going back to a pilot program with the federal government. It lowers costs, and we can further expand this very effective treatment. The bill also includes funding for online behavioral health program Locator, which is new, and additional funding for school-linked mental health grants across the state. Also, the bill funds the 988 Suicide and Crisis Hotline and contains mobile health crisis grants. The bill also expands the continuum of mental health care access for startup grants at psychological residential treatment facilities. There are many, many other items to highlight in this bill. These are just some of them. Just a couple more I'll mention. Providing grants for school-based health center guidance in our towns where these health centers attached or within or next to schools will help increase access for children and families in your local districts. And rural health workforce grants for underserved clinical rotations and primary care residency. Finally, lead remediation in schools and child care centers, brought to us by Rep. Howard. And again, I believe Chair Liebling mentioned the provider network adequacy requirements by Representative Kraft. Lots of good things in here, members. Expanding access and lower barriers is the theme. Improving health, improving lives in all our districts. Thank you, Madam Chair.
The member from Ramsey, Representative Pinto.
Thank you, Madam Speaker. So members, we're now pivoting from the health side of the report to the children and families side. To remind you, our committee had some funding that went through the early learning area through MDE. We passed a bill now signed into law since on that side. And I've been so grateful to Chair Liebling for the partnership in pulling all this together. A few more thank yous. My legislative assistant, Zara Khan, for her work. Committee Administrator Coley Colburn, who's been at my side all the way along and has challenged me and been a partner, and I've appreciated it. The partisan research staff, DFL and GOP researchers, Molly Peterson and Jody Withers. That title does not do either of them justice at all. Molly Peterson has been absolutely critical in helping me and us work through the issues in this bill and to get to the place where we are. And I know that Jody Withers has been critical for his members as well, as he supports the entire education side and probably didn't realize he was going to have to learn about and probably maybe already knew about homelessness and economic support issues as well in this work. I'm so grateful to you. To our nonpartisan staff, Annie Mock, Sarah Sunderman, Danielle Punelli, House Research, the incredible Doug Berg in House Fiscal. I cannot thank you enough for the work that you've done and for the help you provided. The staff in the Revisor's Office, you have been amazing unsung heroes in this as well. Grateful to the staff at DHS and the Children's Cabinet as you've assisted us along the way. And then members of the Children and Families Committee, Lee Daniels to you, my Vice Chair, Representative Keeler, who's been a total partner in this work, and I'm so grateful to you as well. And then finally, Chair Liebling and Chair Wiklund in the Senate to get us where we are. And where we are, members, is we're on the last day of session. And it is another good day to get all Minnesota kids off to the great start that they deserve. We know that there is no better investment, there's no bigger payoff, and I am so delighted to let you know that this Conference Committee report does in fact contain those investments, and we can look forward to those amazing payoffs in the many years to come. And I want to just note that this builds on so many of the other budgets that we've passed this session, the child tax credit through Chair Gomez's committee, the historic investments in education, not just in the early learning bill, but Chair Joachim in her work in the committee in K-12, and then all the way up to higher ed, Chair Pulowski, and the housing bill. All of this is about getting kids off to the great start they deserve and making sure that our state is the best place to raise a family. So this Conference Committee report rounds out that work. It's appropriate on the last day then, members, because we are making sure that kids and families experiencing homelessness have the stability that they need and that they deserve. The numbers are a little bit less than when they left the House, but they're a lot higher than the Senate had, making sure that we have investments in shelter capital, have physical infrastructure to be able to take care of people who are experiencing homelessness, and operations through emergency shelter program and to support homeless youth. And I know Vice Chair Keeler will talk about this more as well. Members, all the provisions we had regarding food security, regarding safety and economic supports for families, those are all still intact after this process. They are still there. We know that we're still providing support to families. And then the major economic support of childcare and early learning, knowing that that's important for parents in the short run, for employers, and certainly for our young people and for all of us in the long run, that kids get that high quality start. That's all in there as well as it came out of the House, with one exception, that the monthly payments to try to lift the poverty level wages of the people who do this work, those amounts are significantly higher through this negotiation. And that means that that's something that we're going to have more stability in that sector and more recognition that that is a public good that in fact needs public support, just like early learning does higher up as well. And we have in this Conference Committee report the system reforms that left the House as well and are coming back just as they were, including the establishment of a state agency to focus our state's efforts on the thing that is of no higher importance than supporting kids and families. Members, you can be very proud of this report when you eventually get the chance to vote yes on it. I certainly am as well, and look forward to the discussion in the coming hours. Thank you, Madam Speaker.
The member from Clay, Representative Keeler.
Thank you, Madam Speaker and members. To continue the thanks, I want to thank you, Speaker, because the homelessness prevention conversation really started 3 years ago when we had a division in the House, and it allowed Chair Gomez and I to really dig into how does homelessness tie into all of these other tables, whether it's education, healthcare disparities, public safety, the list goes on. And we heard a lot of the stories, and we heard a lot from the advocates and the individuals who took it upon themselves to show up and have really painful conversations. And so in the work that we've been able to do as we look at what makes a healthy Minnesota and what creates a great start is really I and many of us continue to believe it's food and housing. I told the story earlier and I'll tell it again that when I did my practicum at MSUM, I asked my community, long before I ever knew I was going to do this job, I asked my community, what were the barriers to academic success outside of academic rigor? So I wasn't asking, is science hard, is math hard? As you know from the education bill, I did a lot in that space. But 2 of the top 3 answers were food insecurities, and they didn't know where they were going to sleep at night. Now, there's a lot of educators in here, teachers, principals, that we talk a lot about when our kids don't know where they're going to stay at night, there's no possible way that they can thrive in the best possible way. So what I'm really proud of in this bill is that we stood firm on the House position in a couple areas. As you remember, we all voted the Pathway Home Act bipartisanly off this floor, which created a stool of support to really invest in ending homelessness, particularly with our youth and our sexually exploited individuals. So we stood firm on that. We have historic investments to make sure that we don't just do one-time Band-Aid fixes, but we actually stop the bleed from greater Minnesota and invest in the things that we're doing here. We also bipartisanly passed off this floor $5 million worth of money to go out to food shelves because they were in the middle of a mass critical need, making sure that we could stick to our obligation to provide 2 days worth of food or 6 pounds to individuals seeking that. So this bill follows the House position and makes sure that we're putting money out into the communities to invest in the food insecurities that they have. Lastly, we also voted bipartisanly to enact the Minnesota Indian Family Preservation Act. So in this bill, what we did is we really stood firm on the House position to make sure that we fund our tribal nations as we continue to grow and build our ICWA infrastructure here in Minnesota. So thank you all for the work that all of you have done. Thank you for the advocates for continuing to show up relentlessly to help us understand what we should already know. And I continue to have hopefully a healthy conversation and that we vote green. Thank you.
Messages from the Senate.
Message from the Senate. Madam Speaker, I hereby announce that the Senate has concurred in and adopted the report of the Conference Committee on Senate File Number 2995. The Senate has repassed said bill in accordance with the recommendations report of the Conference Committee. The message is signed Thomas S. Bodden, Secretary of the Senate. Conference Committee report on Senate File Number 2995, an act relating to state government, health, and human services. The report is addressed to the Honorable Bobby Joe Champion, President of the Senate, the Honorable Melissa Hortman, Speaker of the House. We, the undersigned conferees for Senate File Number 2995, report that we've agreed upon the items in dispute and recommend as follows. The report is signed by 4 of the 5 members on the part of the House and 4 of the 5 members on the part of the Senate. Liebling moves that the report of the Conference Committee on Senate File Number 2995 be adopted and that the bill be repassed as amended by the Conference Committee.
Representative Liebling.
Thank you again, Madam Speaker. This is the official conference report that has now come over from the Senate. So that is my motion. We've been discussing it, and thank you, members.
Schumacher moves that the House refuse to adopt the report of the Conference Committee on Senate File Number 2995 and that the bill be returned to the Conference Committee.
The member from Rock, Representative Schumacher, to your motion.
Thank you, Madam Speaker and members. Just asking to send this back to Conference Committee and would ask for a roll call on this.
Representative Schumacher requests a roll call. Seeing 15 hands, there will be a roll call. Discussion to the motion to refuse to adopt. Representative Schumacher.
Thank you, Madam Speaker. Just requesting this. We didn't get a whole lot of time to review the bill that was in front of us. Didn't get the chance to get the feedback from the groups that are interested in this and hear some of their testimony from what was forward, trying to piece a lot of it together through text message and hallway conversations quick today, and just would have appreciated that. And so thank you for your consideration.
Further discussion on the motion to refuse to adopt. I recognize the member from Anoka, Representative Scott.
Thank you, Speaker Wolgamott. Members, there's a very troubling piece of legislation in this House file. This would endanger our kids because what it does is when someone applies to work at a child care center or a licensed daycare, that person has to do a background check. And up until this bill, now this is a Senate provision, so it hasn't been heard in the House, but up until the provisions in this bill, that information has been made public so that the child care center or provider and the parents are required to know if a person gets a diversion or a variance. This eliminates that language. Members, this is really dangerous. As I've said before in this body, over and over again this session, we used to protect our kids in the state of Minnesota. Under this provision, they will not be protected. There's a whole list of currently disqualifying provisions by which a person can be disqualified to work in one of these centers, or if the commissioner under current law says, I'm going to give this person a diversion, that information will be made public. Not anymore. It's all going to be smoke screens. So your children at these child care centers can be vulnerable for a whole host of being in an environment where a person that is supposed to be disqualified, or if they're disqualified under current law, the parents and the child care centers now are required to inform them. That won't happen anymore. Members, this is a really, really dangerous provision in this bill. I'm super disappointed that this wasn't heard in the House, and I know things get tucked in from the Senate, from the House, that were never heard in either one or the other of either bodies. And sometimes we have provisions that come into these omnibus bills that were never heard at all, and we've got some of that in this bill too. But this is really dangerous, members. We need to send this back. We cannot adopt this conference committee report and put all of these children at risk. Please vote to send this back.
Further discussion on the motion to refuse to adopt. I recognize the member from Hennepin, Representative Robbins.
Thank you, Mr. Speaker, and I rise to concur with the motion not to adopt. This language is really troubling, and literally we found out about it just minutes ago. And I spent the last year with some of my colleagues in this body on a task force to look at how to deal with permanent disqualifications, 15-year disqualifications. We met monthly, sometimes twice a month. It was a really in-depth process, members. And that this language is in this bill. There was no hearing in the House. I don't know what process there was in the Senate, but this is terrible language, members. Right now, how the process works is if someone is disqualified because of various felonies or misdemeanors, they can still apply for a job in child care areas or other areas, foster care, adoption, in working with the disabled, vulnerable people, but they have to go through a process at DHS where they can apply for a set-aside or a variance. And if the commissioner and the team at DHS grants the set-aside, then they're allowed to work in these fields. But that data is public under current law, so that the employer, the child care agency in this sense, when they're doing a background check, they would know this person's background. Under this provision, we are explicitly turning this data from public data to private data. And we are saying it explicitly as it applies to child care centers, a family child care provider. I cannot believe we're doing this, members. People who run and own child care centers would want to know this part of the background of a potential employee. And certainly families, under the law currently, licensed family child care providers and child care centers must provide notice as required under 245C. That language to require that the child care providers provide notice to the families at their centers of the person who's been hired and the background study that they've been received a variance, that language is struck in this bill. We are changing this from public data to private data and no longer requiring child care centers to even know who they're hiring or to provide notice to the parents who they're hiring. I have no idea why we're doing this, members, but this is terrible. This is going to put our kids at risk, and it is going to hurt child care centers. So let me just, for real clarity, it keeps referencing for findings under 245C subdivision 15 and 16. So subdivision 1 is permanent disqualifications, which are not covered. Subdivision 2 are 15-year disqualifications. So if someone has committed one of these crimes and receives a set-aside, that is currently public, and we are in this bill making it private. An individual is disqualified for 15 years if they have committed a felony-level violation of any of the following offenses. So this is felony-level violations for any of the following offenses, members. Wrongfully obtaining assistance, fraud, federal SNAP fraud, felon in possession of a firearm, criminal vehicular homicide or injury, suicide, assault with in the 3rd or 4th degree, assault in the 5th degree, crimes committed for the benefit of a gang, criminal abuse of a vulnerable adult, members, financial exploitation of a vulnerable adult, drug use to injure or facilitate a crime, simple robbery, false imprisonment, manslaughter of an unborn child in the 1st degree, manslaughter of an unborn child in the 2nd degree, assault of an unborn child in the 1st degree, assault of an unborn child in the 2nd degree, medical assistance fraud, coercion, attempt to coerce, aiding an offender, aggravated 1st degree or 2nd degree tampering with a witness, theft, possession of shoplifting gear, bringing stolen goods into Minnesota, arson in the 3rd degree, burglary, possession of burglary tools, insurance fraud, aggravated forgery, check forgery, obtaining signature under false pretense, possession of dangerous weapons, machine guns and short-barreled shotguns, adulteration, terroristic threats, fraud in obtaining credit, financial transaction, credit card, indecent exposure, obscene materials and performances, distribution and exhibition, certain persons not to possess firearms, drugs and controlled substances, or felony level conviction involving alcohol use. And then there are 3 more subsections that this applies to. Members, what are we doing? That data should continue to be public. It should continue, if someone commits one of those crimes and they get a set-aside, we're not saying they won't still get a set-aside. We're saying that that data should be continue to be public. The reason for the commissioner's decision should continue to be public, and families should be notified, and child care agencies who are doing background checks on potential employees should be notified. It's the least common denominator providing safety in our child care system. Vote not to adopt this. Thank you.
Further discussion on the motion to refuse to adopt. I recognize the member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker. And, you know, members, I'm sorry this is so upsetting to you. The reality is this is federal compliance. That's what the department is telling me. You know, well, you can shake your head, but I mean, when the department says that they have to change something in the statutes to comply with federal law, which actually does happen quite a bit, usually that's what we end up doing, and so that's what we're doing here in the bill. Thank you.
Further discussion on the motion to refuse to adopt. I recognize the member from Chisago, Representative New Brindley.
Thank you, Mr. Speaker. Would Representative Liebling yield for a question?
Representative Liebling will yield for a question. Representative New Brindley.
Thank you, Mr. Speaker. Representative Liebling, I appreciate what you just said, that we've been told that this is to comply with federal law. I'm hoping you can help us understand what federal law we need to comply with, that we need to make these changes for in state law.
I recognize the member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker. Well, I'm sorry I can't do that. I'm not an expert on this, but I have to take the department's word for it. And if you have reason to believe they're not giving accurate information, you know, we'll have to fix it. But I don't think we have that.
Representative New Brindley.
Thank you, Mr. Speaker. Frankly, if I were the chair of a committee and I was going to choose to change state law in a way that will put children in danger, I think I would want those answers before I did that. I think if I was being told that I had to change something to comply with federal law, I would make darn sure I knew what that was before I made these changes. Representative Robbins went over a number of the problems, and I'll just be honest, as I read this, and I understand that this was in the Senate language, this came out of the Senate, this did not come out of the House. We certainly never heard this in any House committees, so this is legitimately the first time we have ever seen this language. There were not conference committees held throughout this process for health. There was a conference committee held at the very beginning of the process, I understand, and there was a conference committee held, was it just this very morning? I think just this very morning there was a conference committee held as pretense, right, to get it out the door. So this was never discussed openly and transparently. House members have never had a chance to see this until this very moment. And I understand that actually we have a child care crisis in the state of Minnesota. But these changes seem like a very odd way to deal with our child care crisis. To not just allow people convicted of these crimes to work in child care centers, but to not allow anybody to know about it. Frankly, if we were going to say, hey, people who have been convicted of these crimes can now work in a child care center, but the owners are going to know about it, the operators are going to know about it, the parents are going to know about it, the commissioner's going to know about it. Frankly, while that still makes me incredibly uncomfortable, you can at least understand there are some safeguards in place for children. But that's not what we're doing here, and so we have made this motion to refuse to adopt so this can go back to committee and be fixed. Because this absolutely must be fixed. So under this new language, we are now saying that for any disqualifying characteristic, and if anybody wants to follow along, we're on page 360, for any disqualifying characteristic except a felony level conviction for a drug-related offense, when the state set aside relates to a child care center or family child care provider, a disqualifying characteristic, and it goes through these disqualifications. Those things are all being deleted from state law. They're all being deleted in this bill from current state law that is in place to protect children. And we are deleting these protections. And again, I want to be very clear. Representative Robbins listed off what some of those things were. I've just highlighted what I believe. There's lots of things. Frankly, like I said, I can actually understand if this data is made public and childcare owners and operators and families are allowed to know. There are actually some things on this list, this disqualification list, that I would say, you know what, that's probably okay if they're working in a child care facility. That actually is probably okay. But we did not take that approach. We are eliminating all notice. And it's for things like assault, criminal abuse of a vulnerable adult, false imprisonment. We're talking kidnapping, false imprisonment, use of drugs to facilitate a crime, coercion, arson, what could possibly go wrong? Dangerous weapons, machine guns and short-barreled shotguns, rioting, terroristic threats. I'm particularly concerned about things like indecent exposure, that there's going to be no disclosure of somebody who's been convicted of indecent exposure. We're going to say that they get to work with children, and the child care centers don't get to know about it. The parents don't get to know about it. In fact, we're making sure the commissioner doesn't even know about it, because in this new language, we're gonna protect the commissioner and we're gonna protect criminals. That's what we're doing. Some other things: obscene materials and performances, distribution and exhibition prohibited. More assault, assault against a vulnerable adult, domestic abuse. Someone can be convicted of domestic abuse, and we're not going to let child care providers, parents, the commissioner know about that. Criminal abuse of a vulnerable adult, mistreatment of persons confined. I don't know, that sounds like a problem in child care facilities. Mistreatment of residents or patients. Again, as somebody who has worked in facilities where I am caring for residents and patients, this is alarming. This is alarming. Failure to report maltreatment of a vulnerable adult. Abduction. We're literally talking about kidnapping, but our child care providers, parents, even the commissioner, they don't get to know about this. If somebody has been convicted of abduction, literally kidnapping, neglect or endangerment of a child is on this list. Neglect or endangerment of a child. And we are now going to say that child care facilities, parents, don't get to know if an employee is convicted of negligent or endangerment of a child, neglect or endangerment of a child. Dangerous weapons, disorderly conduct against a vulnerable adult. Again, indecent exposure, harassment, obscene materials and performances. What could possibly go wrong in a child care center? Harmful materials, dissemination and display to minors. This is alarming, folks, and I get it. Things move very fast at this end of session, but I think we've already got an agreement to make sure that we've got sort of an orderly wrap up of the day today. So we've got a lot of hours left. We've got, 10 hours left? That this can go back to committee. This is a very quick fix to pull this out. This is a very quick fix to pull this out. But folks, this has to be fixed. We cannot move forward with this bill with this language in it. This must be fixed. We've got about 10 hours. There is already a commitment from our caucus, from our side of the aisle, to make sure things get done in an orderly way today. So let's do that. Let's send this back quickly. We can show you exactly where the lines are that need to be fixed, and we can get it done. We can get it done, and we can still get this bill off the floor today. I would recommend, folks, that we do that. No one in this chamber wants to vote for this bill with this language in it. No one. This is really dangerous. This is alarming. Let's refuse to adopt and send this back real quick.
Further discussion on the motion to refuse to adopt. I recognize the member from Lyon, Representative Swedzinski.
Thank you, Mr. Speaker. Thank you, members. Would Representative Liebling yield for a question?
Representative Liebling will yield for a question. Representative Swedzinski.
Thank you, Mr. Speaker. Representative Liebling, just a quick question. It's my understanding this bill was posted late last night. What approximate time was it posted?
I recognize the member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker. Well, it is clear that this was posted later than we had hoped, because it is a large bill and it took a lot of staff time and was took a long time to put it together, and it was not ideal that it was posted late. But I do want to take the opportunity to respond. I was going to also be recognized, or hope to be recognized, and just to say that the discussion that we've been hearing here is really off base, because this is federal compliance. I can give you the citation if you really want to have it. But basically, all this is about is whether the this language is not letting anybody be in a child care center who wasn't able to do it before. It's not changing anything about who gets a set aside or what is disqualifying for somebody. It's simply saying that the information is not public. And this is federal compliance. I know it's fun to stand and read a list of bad offenses and be really outraged about it, but this is federal compliance, and it just says, I was given a little bit of the law that I could give you the citation. It says, no state shall publicly release or share results of individual checks. So, you know, this is just about somebody who's had a set aside, and so the people who need to know.
Point of order, Mr.
know.
Speaker.
And that's
Representative
all this
Swedzinski,
is.
state your point of order.
Mr. Speaker, I was pretty focused on my questioning to Representative Liebling about what time the bill was posted last night. If the member could please answer the question for the benefit of the body, I'd appreciate that.
What section of our governance are you citing for your point of order?
Line 202, or Rule 202.
Of Masons?
Sure.
Or of the rules of the House?
Whatever point of order ask the question, I'd appreciate. Thank you, Mr. Speaker.
Representative Liebling, you have the floor.
Thank you, Mr. Speaker, and thank you, Representative. I've never heard of a rule that says that you have to exactly and only answer a question that's asked. I think when you ask me a question, you're giving me the floor. Thank you. So, Child Care Development Block Grant, Article 42, United States Code 9858, sub E, sub 2, sub C. So, yeah, it's, you know, just because somebody sounds outraged doesn't mean there's something outrageous going on. Thank you.
Representative Swedzinski.
Thank you, Mr. Speaker. I had a little difficult time hearing. Could Representative Liebling repeat that citation again? Thank you. Yes, Mr. Speaker, would Representative Liebling yield for a question? Mr. Speaker, Representative Liebling, would you repeat? I had a little difficult time hearing. Could you repeat that citation again? Thank you.
Thank you, Mr. Speaker. So it's from the Child Care Development Block Grant, Article 42, United States Code 9858, sub E, sub 2, sub C. Thank you.
Representative Swedzinski.
Thank you, Mr. Speaker. Would Representative Liebling yield for another question?
Representative Liebling will yield for another question. She will yield. Representative Swedzinski.
Thank you, Mr. Speaker. Representative Liebling, the question I asked you before was what time was the bill posted last night?
I recognize the member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker. I'm not sure of the exact time. I think that's available. An email went out right when it was posted, and I think it's in your email inbox.
Representative Swedzinski.
Thank you, Mr. Speaker. Thank you, members. You know, I think that answers the question quite soundly. It's my estimation around midnight is when this bill posted. And even the author of the bill didn't know when that was. Folks, if you do the math, right now it's about 14 hours since that bill has been posted with many changes, many out-of-the-blue provisions that lay before this body. 14 hours ago. And just in our brief conversation with Representative Schumacher, I asked him how many pages are actually in the bill. 844, approximately. If you like math, take 14 hours, divide it by 60, and that gives you approximately 1 minute. 1 minute per page to read this bill. Representative Liebling said, well, it's a little later than we like. Folks, with the DFL trifecta, the people of Minnesota are suffering beneath the Titanic of water and Titanic of an iceberg that's going to hit this state. Folks, the unborn are suffering from this bill. As Representative Noor, folks that work at our child care centers and attend our child care centers are going to suffer underneath this bill. All in the dark of night, around the same time the Titanic hit an iceberg, this bill came and dropped before us. There's no life rafts in this bill. Folks, we have an opportunity to do what's right. Vote with Representative Schumacher. Send this bill back so that folks can see the icebergs that are coming. Folks, this is a radical agenda bill that is drastically going to change the opportunities for Minnesotans. Offering health care to citizens of foreign nations. We can't even pay for our own folks here at home. Talk about a budget blowout. In the dark of night, with just hours left, the DFL trifecta can't get their stuff together, and here we sit with moments a page to look at this. This is 40% of the budget, for crying out loud. 40% by billions. $1 billion a minute, probably, this bill is going to take us to read this bill. Folks, do what's right. I understand we've got hours to go. Put this bill back so that we can fix the problems that this bill is creating for Minnesotans, our hospitals, the unborn. Folks, taking away the few guardrails left for life. Vote with Schumacher. Send this thing back.
I will remind the body that under Mason's section 240.1, paragraph B, that a member wishing to rise to a point of order must state the point citing the authority that they have risen to a point of order. Further discussion on the motion to refuse to adopt, I recognize the member from Anoka, Representative Scott.
Thank you, Mr. Speaker. Would Representative Robbins yield to a question?
Representative Robbins will yield to a question. Representative Scott.
Thank you, Speaker Wogelmatt. Representative Robbins, I know that you mentioned that you've been part of this task force. Could you tell us more about that? And in this task force, has it ever been made known to the people in the task force that there's some federal compliance around this particular issue?
I recognize the member from Hennepin, Representative Robbins.
Thank you, Mr. Speaker. Thank you, Representative Scott. No, in all the meetings we had, requirement for federal compliance was not brought up. Nor was there a bill introduced that I was aware of from the recommendations of the task force.
Representative Scott.
Thank you, Mr. Speaker. Well, there you have it, folks. Someone that's on the task force centered around this very issue. This is the first time she's hearing that this is a federal compliance issue. Members, I'm going to go out on a limb here and say there are plenty of things that this body decides and that are on the statute books where we don't comply with federal law. And in fact, there's a provision in our law, there's a provision that says that we as a state body can have a more restrictive law than the federal law. Members, this is more restrictive for a reason. Sunshine. Sunshine to the parents, sunshine to the businesses. Now, can you imagine being a child care provider and you've hired one of these people, you don't know anything about them, and they harm a child in some way? Now, according to this, you probably may not be held liable, but do you really think the other parents are going to want to continue to bring their children to your facility knowing this? I doubt it. Members of the public, I want you to know that if you put your children in child care after this, be aware. Be aware. Because some of the people that are supposedly working in that environment have not been well vetted. And they may have a criminal past that you are not aware of that could put your child in danger. Members, refuse to adopt this horrible bill. This is just one of the many provisions that are bad. Thank you.
I recognize the member from Ramsey, Representative Pinto.
Thank you, Mr. Speaker. Members, I don't have to speculate about what a child care provider might be thinking, because actually we received a text message from one who's watching this debate and who says that those opposing this, quote, have it all wrong. This person says, and before I read that, actually, I should just note, there's no change in this to who needs a background study. There's no change to this of what offenses are disqualifying. There's no change in this to the circumstances where a set-aside or a variance might be made. That's what this is about, by the way, is that if there's, in fact, a circumstance where there might otherwise be a disqualification. In some circumstances, under current law, no change in this bill at all, what we're talking about here, the commissioner can set aside or give a variance to say, hey, we're going to still allow this person to work. In those circumstances, what this does is say, hey, that the data is private at that point, and what the person, what this child care provider is noting is that we don't currently get to know why the person is disqualified. We only get a letter saying they are disqualified. They aren't saying we allow these people, they're saying we don't get to know, and that's for their protection. That's what's happening currently, and presumably the reason that's happening currently is because that is in fact federal law, and what this is doing is catching up our state statutes to federal law. Chair Liebling read the site before of the particular provision, but actually you probably want to go a little bit higher in that 42 USC 9838, because that whole paragraph E is about background check results and appeals, talking about the state conducting a background check. The state has to provide the results of the background check to the provider that indicates whether the staff member is allowed to work or not. But it is very clear that the state is, no state shall publicly release or share the results of the background check. So that is something that is required by the feds. This is a federally funded program. And the thing is, apparently, from this provider, that's how things work right now. What the provider is told is either this person is allowed to work for you or is not. And there's not the other details. That's current law. What this statute is doing is catching up. I do want to point out, of course, there's nothing to prevent the provider from conducting their own background check if they want to. That's a separate matter. But this is how the law currently works. It doesn't make any changes about who's disqualified. And let's face it, if you're a commissioner, boy, you're going to be really, really leery of providing a set-aside for some of the offenses that were listed in that list, because the commissioner is going to be on the hook at that point. If somebody who has some troubling criminal past is working for a provider, that suddenly the commissioner is going to be on the hook for having made that set aside. But anyway, all that is current law. This is how that works currently. We're catching up to making sure that our statutes reflect how that's supposed to work. And so, members, I think we should move on to another portion of this bill. Thank you.
I recognize the member from Anoka, Representative Niska.
Thank you, Mr. Speaker, and I was wondering if Chair Pinto will yield for a question.
He will yield, Representative Niska.
Thank you, Mr. Speaker, and Representative Pinto, or Chair Pinto, is Minnesota currently receiving block grants under the 2014 block grant law?
I recognize the member from Ramsey, Representative Pinto.
Thank you, Mr. Speaker. Representative Niska, I don't know that we're receiving from the 2014 block grant. There is a series of federal block grants, and so Minnesota does receive some funding on that. I should probably have noted before that this provision was on the health side of the bill, so I wasn't as familiar with it, more in Chair Liebling's area, but because it relates to child care, I've been looking into it a bit and I'm able to provide the information that I just did. Thank you.
Representative Niska.
Thank you, Mr. Speaker, and would Chair Liebling yield for a question?
Representative Liebling will yield to a question. Representative Niska.
Thank you, Mr. Speaker, and Chair Liebling. Same question to you. The language we're asking about, or we're talking about, is from a 2014 federal block grant program that says what conditions the state needs to comply with in order to receive those block grants. And my question is Minnesota currently receiving block grants under that program?
I recognize the member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker. Well, I really have no idea, Representative Niska, if we're receiving those block grants or not. But the discussion's been about whether this is, in fact, in compliance with federal law. And I think Chair Pinto was pretty clear in his discussion that it is, and that it's not really any big change. So, and by the way, this was part of the governor's budget proposal, so it was certainly there and certainly has been out there, didn't appear out of nowhere. And if members on our committee had really cared to look at the bills, which I did exhort them to do, a number of times and had wanted to read the governor's budget proposals. It's all been there, and they could have certainly done that.
Representative Niska.
Thank you, Mr. Speaker, and I guess that's as enlightened as we're going to get on this issue here today, except you can actually go and read the statutory provision, the federal statute, which is a requirement that Minnesota needs to follow in order to get block grants. So either we are receiving federal block grants right now, which means the federal government has not pulled them and does not think that our current statute fails to comply with federal law, which is how I read the federal statute, to be frank, and we'll come back to that. Or we're not currently getting them, and we don't need to change the law to comply with the federal conditions. And we shouldn't change our law to comply with these federal conditions. Representative Pinto described the situation mostly correct, which is when we currently have background checks, we don't publicly release that background check. We just say that that person is not eligible if they're not eligible. But what we're talking about here isn't just someone not being eligible. It's when the commissioner exercises discretion on this whole long list of criminal statutes that Representative New Brindley read, including, indecent exposure to children, kidnapping, etc. If the commissioner ever exercises their discretion to give a variance, then, yeah, some people sure as heck have a right to know about that. And that's what current law does. And it does not violate federal law. Federal law says that no state shall publicly release or share the results of individual background checks. We're not talking about sharing the results of individual background checks. That's what Representative Pinto was talking about. We don't share the results of the individual background checks. We just give a letter that says this person was ineligible. But what we can do and what we should do and what we do right now and won't do if this bill passes is when, after the background check is done, we do a variance, we overrule that background check, and we say, okay, never mind, even though this person failed the background check before, we're going to let them do it anyway. The federal law does not prohibit us from doing that. If we are currently receiving block grants, and I'm no more of an expert than the chair of this committee on whether or not we are currently receiving block grants, so I apologize. I wish more people knew in the chamber that kind of important basic fact. But if we are currently doing it or receiving those block grants, unless the federal government has told us they're pulling these block grants unless we do this change, then the federal government is not requiring us to do that. And frankly, I'm of the opinion that if the federal government is telling us to endanger kids this way, we should tell them to stuff it. And that means we should send this bill back to committee. Please vote yes.
Further discussion on the motion to refuse to adopt the Conference Committee report for Senate File 2995. I recognize the member from Wright, Representative Hudson.
Thank you, Mr. Speaker. I'll be brief. I just want to point out that I think that this type of process is what severely erodes public confidence in this institution. We've had it said here on the House floor today that this language was inserted into this Conference Committee report because a department told us so. A government department, not an elected official, not a member of the public, but a state agency. And the rationale provided was we need to comply with federal law. And so we just say, okay, rubber stamp and move forward without questioning what the impact of that language is going to be. And it's very odd to make that choice in the wake of passing a bill just recently off this floor that legalized marijuana. You realize marijuana is still illegal federally? Federal compliance doesn't seem to be a thing that is a particularly high priority. And so the idea that when it comes to the minutia of what's taking place in our health bills and our child care bills, that when a department says we need to comply with federal law, we're just going to say, okay, and rubber stamp it without looking into it, without understanding it, without knowing what we're doing. It raises the rational question of who is governing this state? Is it us? Or is it them? I stand in support of this motion.
The member from Candio High, Representative Baker.
Thank you, Madam Speaker. Just a quick question. I wanted to sort of dovetail a little bit on what Representative Hudson was just saying and others earlier about the background checks. I'm not going to get hung up on it, but Representative Pinto, when you were saying you're following federal compliance, I understand that. Nothing is changing except we're not telling the public any longer. That's a big deal. And as I have learned this way around here over the last 9 years is that you fight hard for things you believe in. And what I hope you did with this conference committee, through yourself or Representative Liebling, is that you fought hard to why would we want this to happen? I have worked alongside Representative Edelson on the reasons to modify and update the background studies and how poorly run this is now. We have to make changes, and thank you, Representative Edelson, for the work you've done in this. But this is about the kids now. This is about children and the people that we have watching our kids, and now we're just saying that not having it on a public awareness, a public site where we could check on this thing is not going to happen because the feds are telling us it's just not going to happen. I don't know what we did to fight hard for that. I'm not going to spend a lot of time on that, but I'm just saying right now, this is wrong. We should have fought. This just because the Fed said it's how they should do this doesn't make it right. We know better than this. And so I think that's something that we can do better. But my question actually, Madam Speaker, and I think I will ask the Chair, Liebling, to yield to a question if she would, please.
She will yield. Representative Baker.
Representative Liebling, thank you for the work. I guess there was one bill that I had heard this year that I was actually quite intrigued with. Representative Ryer carried the bill on the Rare Disease Advisory Council. It moved me enough. I signed on the bill. I wasn't signing on a lot of bills this year as a co-author. It came out of the Senate, came out of the governor's budget as fully funding in the $1.2 million request. There's a lot of people with eyes on this thing because they want to grow and understand this need to get children and folks help sooner than later, because when you find out what's going on with a child with a rare disease, time is everything. But Chair Liebling, the bill came back half of what it was, and I just want to ask you the question, what happened to that important provision that was supported wholeheartedly by everybody else, the governor and the Senate office and Senate side? Can you just help me understand what happened to that funding in this important area?
Representative Liebling.
Thank you, Madam Speaker. Well, Representative Baker, the Senate can't win everything. I don't think we heard that bill, and it was funded at the base level. This was, my understanding, this was kind of the organization in the last budget cycle came over and was part of the state, I think under the Council for Disabilities, and for the very first time, and came in and asked for base funding, which we did provide, and they wanted additional funding, which they didn't get. I mean, there are a lot of things in this bill, and the Senate brought that in. We did not hear it, and it was just something that was left to maybe look at again next year.
Representative Baker.
And thank you. I had, again, hearing the bill with Representative Ryer, I assumed that was part of this bill. I thought it was in the House language. I still think it is. I'm going to double check on that. But again, just for members, this Rare Disease Advisory Council is important. It's something that we need to find ways of getting to them sooner. I would have assumed that, again, working through the sames and similars, it would have matched up pretty nicely. I will recheck that. But again, my notes show that it was part of everybody's agreement early on, and I just want to keep it on the radar then, Representative Liebling, for next year. I hope that we can do better. This is an important one, so I appreciate your time. Thank you.
Any further discussion on the motion to refuse to adopt? Seeing none, the clerk will take the roll on the motion. The clerk will close the roll. There being 63 ayes and 69 nays, the motion does not prevail. We return to the motion to adopt. Discussion. The member from Traverse, Representative Backer, on the motion to adopt.
Madam Speaker, I want to speak to the third reading.
Any further discussion on the motion to adopt the conference committee report? Seeing none, all those in favor, please say aye. Aye. Those opposed, please say no. No. The motion prevails. The clerk will give the bill its third reading as amended by conference.
Third reading, Senate File Number 2995, as amended by conference.
Third reading as amended by conference. Discussion to the conference committee report. The member from Traverse, Representative Backer.
Thank you, Madam Speaker and members. A couple things. First of all, to the chair, I do appreciate of keeping the EMS provision in the bill. That is the one thing that I do like. It allows, just to let members know, it allows rural, especially rural ambulances, to work with ambulances next to them. So if we can't cover a shift, law used to be up for 12 hours. Now we can go 24 hours. So thank you, Chair, for keeping that in. I do appreciate that. Couple things that concerns me, though, that what we're seeing in the rest of this bill, we are seeing extremely concerning, especially, first of all, we see a 65% increase in MDH, where if we look at it, this bill does not provide funding for hospitals, rebasing, and critical access hospitals. So for a lot of us members on this side of the aisle and some on that side of the aisle, this is quite concerning. My ambulance, we actually deliver patients, not deliver, that's not the right words, excuse me. We take the patients to Wheaton, Graceville, and Nortonville. And those hospitals, and then one into South Dakota, Sisseton. And those hospitals right now are not flush with money. They are not flush with money. When you have these hospitals that are operating on 1 or 2%, and quite a few of the hospitals are not even are running in the red, I'm very concerned because it puts not just a financial burden. You know, we can talk about finance, but I'm here to talk about life. Because when people dial 911 in my volunteer profession, they're not dialing to see me at 2 in the morning, because I don't look very good at 2 in the morning. My twin brother looks a lot better at 2 in the morning. But on the serious note, they are dialing me to help them in a life situation, difficult. We've had, since I've been here, I have been able to use my skills since 2015 9 times for 1 staff member, 7 reps, and 1 governor, and so forth. Because people are concerned about their lives, rightfully so. And when we don't fund our critical access hospitals with rebasing and other things, it affects the care that we give to so many members, not just on this side of the aisle, but one of the things we heard a couple times is we do have a lot of the Metro folks, which we welcome them, every weekend comes to greater Minnesota to enjoy the lakes. And we hear this, we heard this through the environment bill and through other bills. When they dial 911, they expect, if it's police, they expect fire, or mostly they're asking for an ambulance. So that's quite concerning. Very, very concerning. Along with that, it really destroys the individual market. When I was campaigning in 2014, door knocking in Douglas County, now Representative Murphy's district, in Grant County, I remember that was the 2nd week in October or 3rd week in October, when I was out in Mold Township and Brandon Township, these people, individuals who have sole proprietorship, entrepreneurs, one-person show, they were ticked when I got to the door. They were very upset that their premiums went up. They're going to be even more upset by going into no individual market. Now, I do respect our chair, but I do respectfully greatly disagree with her getting private, because public doesn't do everything right, and public doesn't deliver health care correctly all the time. I've been in private operated hospitals, hospitals operated private, and hospitals operated by public. And there is a difference. Now, I'm not saying public hospitals are staffed by bad people, but there is a difference when your name is on the line. And so I respectfully disagree with our chair. I know at first it funds a study, but as we know, when we fund studies, then it can lead into other things that we are very, very concerned. That's something that it's extreme. Another thing that concerns me as I am called, when they dial me 911, they expect me to do everything humanly possible to save a life. We just had a situation here a couple days ago where we had a member choking. When I walked into that back room, I saw the faces of many people. Quite frankly, people were scared. I've been on that many times when there's a life and death situation, and frankly, I did not have to do any of my skills. I'm thankful for that. But when I saw a rep coming from the back, I knew something was going on. We need to do the same for infants. I heard this morning from the chair that, okay, we're not going to let infants die. Well, let's side. What I have to do when I'm called on the scene, I have to provide every life-saving measures possible. Not care, life-saving. And yes, it's very passionate. That's why people dial 911 for my service in the middle of the night. And this bill removes that provision. Let's err on life. In 2021, DHS reported 5 infants that were born from an abortion. And if you read that report, it says comfort care. As an EMT, I cannot provide comfort care. My license would be taken away, even as a volunteer. I have to provide life-saving care. Let's err on life. And this provision does not err on life at all, folks. It does not extend the basic human rights of life. Let's just err on life, and we remove that. I know, again, the chair and I will professionally disagree, but that day in the back of the retiring room, people wanted me to err on life if not something needed to happen. When the governor of Dayton, back in I think it was 15, I don't remember, passed out up there, they wanted me to err on life. Was when it was me and Representative Newberger up there first, and then at that time, Senator Jensen. 3 weekends ago, when I was called to the Browns Valley Healthcare Center, they asked me to err on life. August of 2021 was I called to a birth of a 21-year-old baby, no bigger than my hand. They wanted me to err on life. And I don't even like the word err, because that's not what we should be doing. We need to be giving life-saving care. These are just some of the reasons why I will not be supporting this bill, especially that one. That is so important to so many people across this state. Polls show that Minnesotans want to support life. Vote no, members. Thank you.
The member from Dakota, Representative Hewitt.
Thank you, Madam Speaker, and I want to really thank Chair Liebling and her team. This is the most historic investment we have made in EMS. This is going to do leaps and bounds on where we were. We still have a long way to go. But let me tell you a couple things that are really important. Our medical control centers, both at our major safety net hospitals, that's a place when you are out of options in the field, you call into and you say, Doc, I am lost. What do I do next? And that goes throughout the whole state. Chair Liebling not even she put it in her bill, but she made it last. This is now in the base. We've been fighting for years to get this in the base. The other part that's in the base, when we were just recently talking about Representative Baker's bill about the, I'm drawing a blank here, but rare diseases. The rare diseases, this was my whole career. In fact, Jeff, it was so interesting you brought up this, but at the end of my career, I helped deliver over 3,000 neonatal babies to the Twin City area. That was my job. I went out and got those kids and brought them back. But most of them had rare diseases. EMS is being trained by that. And again, the money that Chair Liebling put in her bill to fund our regions, and all of you know what the regions are. If you don't, you need to go talk to your region experts. These are the people that train EMS within the regions about rare diseases. There's money in the bill, and there's money to continue to fund that, because every year we got to go back and get more. Chair Liebling saw that as something we need to continue. And let's talk about the shortage of EMTs and paramedics throughout our state. The educational needs are being met, again, in Chair Liebling's bill, as well as Chair Poslowski's bill, as well as Chair Yukim's bill. In fact, tomorrow at Morris High School, they will be graduating 20 new EMTs because of what we did last year, but now it's going to continue because of Chair Yukim's bill. We're getting there, folks. EMS is on the right direction. We have more work to do. We're going to be doing some work in the interim, but I want to thank you from the bottom of my heart. Minnesota will be a safer place this summer because of what you did in this bill. Thank you, Chair Liebling.
The member from Olmsted, Representative Quam.
Thank you, Madam Speaker. And this is a large bill. There are going to be some good things and bad things. Looking at the bill as a whole, and the many years I've been on these committees, one thing I've seen is a trend towards fewer options, fewer choices, and we saw a little bit of a pushback because we were trying to push something on hospitals, and frankly, the pushback prevented it. Because our hospitals and healthcare facilities are hurting. And part of the reason it's hurting is because there's been an increasing predominance of the public programs which don't pay the full cost. That's cost shifted to the private. And as that percentage versus private changes, the funding gets worse. That's why we've got the issues of mergers is a symptom, and the cause is the financial issue with hospitals. Many times we've done things to help stabilize individual health care options, the private insurance options, private sector, because we're cheating and saying you're going to have to pay more than the cost because we're going to pay less. But now this bill is taking a huge step to push an increase and move us down the path to single payer. And you can say the pros or cons, et cetera, but that has one thing that we can't deny would happen. And that's what it would do is decrease the funding and covering of costs to our healthcare facilities, because no one can deny we cost shift from the government programs to the private, and when it gets large enough, the hospitals start losing millions of dollars. And then they have to merge. And people, oh, they're merging so they can increase their fees and cost structure. Well, frankly, they're failing because they're being forced to lose money, and it's not trivial money, it's huge money. So we can continue to say we're concerned about the symptoms, or we could address. Instead of this bill addressing the underlying fiscal crisis in healthcare, it's making it worse. It's almost as if the intent was to cause a catastrophe so that we destroy the private option and private health care coverage. Another thing that this bill has is, apparently, it's bad when we actually have data to be able to dispute some of the proposals. We just heard 5 children lived and survived, were born alive after an abortion. And besides the language in here making it easier to just let them die, this actually has language to stop taking the data so we don't know how many children survived and were let die. So it's inconvenient data. We won't take it anymore. Now, a lot of people say we need to have government making sure everything is right, and government knows best. About a decade ago, there was a study on the quality of hospitals. I remember it pretty well because in that, Mayo was a bad hospital. So I met with the U of M people that did this study, that took the data, that made the equations and formulas and the factors to find out how that was possible, because I know Mayo is a great hospital. And it turns out that little things like readmissions, the complexity of a case, and other factors weren't even in their calculation. They were simplified, and they came to the wrong result. They improved that analysis, and Mayo got a decent score. But it tells me that the U of M and our bureaucracy isn't omnipotent in making the right choice. In fact, it's not the only time where they made the wrong choice, made assumptions, and it was obviously wrong in this case. We won't know in the next case because you in this bill are saying we don't need to take that data or this data. We're not going to look at that. Or we're going to make data private so that we can't be blamed after something horrendous happens because nobody knows. And government is supposed to serve the people and not control and dominate the people. Government is supposed to help us to come together and do things that we can't do on our own. But one thing that happens too often is government doesn't realize the diversity of our communities, of the people in our state, that even the best omnipotent plan doesn't help everybody. That's why choice and options are needed. We brought up that, hey, we should try to avoid having issues with people that have stumbled in their past, stumbling again, by not putting them in a situation where they're taking care of children or other situations. I'm all for second chances, but we all have our weaknesses. It might be chocolate, it might be a beer or bourbon, or some special dessert, or a scratch game. And if we've had a history of not being able to control one of our weaknesses, we do not put them in a stumbling, so there's a stumbling stone before them so they could possibly make the same mistake. Keep the data private, but if you're going to say, we're going to ignore the fact that they have a propensity or a weakness towards something, allow them to have a job where they're going to have to face that day in, day out, and keep it private. No, if you're going to say, we're going to ignore this flag and a background check and make them able to do that job, we're going to also let the people in that activity know so they can be helpful. I would not go into an AA meeting and hire all the people to be bartenders. I might hire them to be accountants, engineers, and other things, but I would not put them in a situation where their past history shows that they made a mistake, because I don't want to have them make it again. Or if I think that they've overcome it, I'm at least going to have somebody there with them that can help them. But no, this bill says, This bill and a lot of the bills don't seem concerned about victims, past, present, and future. I mean, why do we take a background check? Honestly, if you don't think it matters, why take a background check? And I'm fine with having a decision that this person has changed, because I know people that have changed. But then don't ignore the reason why we actually do a background check. I'm just, I guess, disappointed, which isn't the first time this session. But frankly, it would have been nice if you would have heard the other people, because how do we do the best job? We hear all sides. We try to see different viewpoints and then avoid making mistakes. I'm just glad we're not on the farm, because a lot of us are not looking down every now and then, because this bill, we're going to step in it. And we're going to have to fix it up again, and it's not going to be as easy. And I hope that there aren't any people that are going to have really horrid outcomes because we didn't see and avoid obvious issues. Please vote no.
The member from Crow Wing, Representative Davis.
Thank you, Madam Speaker. Members, I rise today in these House chambers to be a voice, and I'm grateful that I have this voice. I love the First Amendment, freedom of speech. And I will always fight for that right in this country. So I rise today to be a voice, not just for my district, certainly for my district, because I door knocked 5,000 houses in my district. I know there's some who knocked many more, but I certainly know where my district is on this issue. Not only am I going to be a voice for them, I will be a voice for my God, because I have that right afforded to me in the Constitution as well. And I know exactly where He stands on this issue as the living God. I will rise in this moment right now to be a voice for innocent lives, and I make zero apology for it. I'm just going to share with you quickly an experience that I had at the state capitol here, and hopefully I won't get ruled out of order because it does have to do with another bill, HF1. When that bill passed, I heard cheering. I heard hooting and hollering. I heard celebration and one side doing a victory dance, basically, to be honest with you. And I went home that night in tears and grieved. See, at that time, my wife was still pregnant with our child, Seth. And I've had Seth on in this house chamber twice. Many of you got to hold him. And I can remember when we first went to the doctor and we had a telehealth conference with the doctor, a doctor out of a St. Cloud hospital. And one of the first, after we got the pleasantries out of the way in that meeting, the first question the doctor asked us was, and this was after we found out that my son had Down syndrome, trisomy 21. One of the first questions, the first question the doctor asked me was, "Are you going to continue with the pregnancy?" My wife and I, we kind of looked at each other like, what? And my answer was, of course. And her answer was, yeah. And I was blown away that that's the first question the doctor asked. And in hindsight, I'm meditating and thinking about this, and I'm going, I just wonder how many children's lives were ended in the womb because of the seed that was planted because of that question in the doctor's office. Over 90% of children with trisomy 21 in this country, their lives are ended in the womb. Over 90%. That's not made up by me, that is a fact. I've heard that north of the border in Canada, it's almost 100%. And you know, I'll be real honest with you. When we first got the news that my son had trisomy 21, I couldn't explain the emotions I felt. And my wife and I, we actually broke out in tears at times. And I just couldn't quite explain, and I know I'm being very vulnerable with you, but I couldn't quite explain the emotions I was having. And another one of our doctors, we were meeting with the doctor, and she was very compassionate and very good at her job. And she said this, "I think I know what you're going through. You're grieving the loss of the child you thought you were going to have." And when she said that, I was like, whoa, that's it. And a little time went on, I watched a video. I started studying trisomy 21. And I started listening to the testimonies of adults with trisomy 21. And I was blown away by these folks. And I was blown away by the fact that I had a lot to learn in life from these folks. And I had this thought, you know what? These folks aren't less of a person than I am. Perhaps they're more. And I heard the testimony of one person, as someone asked this person, this beautiful woman who had trisomy 21, they asked her, what would you do if you didn't have Down syndrome? And she got this puzzled look on her face, and this changed my life, hearing her testimony. She said, without Down syndrome, I wouldn't be me. I wouldn't be me. And I had this revelation, perhaps she's exactly as her Creator created her to be. I think she got it. And I realized, man, I got a lot to learn. And we're ending over 90% of those lives here in this country. Committing genocide on an entire generation of people. And maybe you don't like what you're hearing right now. I would appeal to your conscience. I'm trying. Ronald Reagan, I quoted him on this floor just the other day, but again, one of my childhood heroes. He said, I've noticed that everyone who is for abortion has already been born. I've noticed that everyone for abortion has already been born. And I have this thought, what hypocrisy that we have as the state of Minnesota. We who have this great right to life and to the freedoms that we enjoy. Every one of us in here is breathing air, that we would deny that right to every person and child who is not breathed air, that we would rob them of that right. And I know the accusations, gosh, I've heard all the accusations towards me and towards others who are pro-life. You're anti-women's rights. No, I am not. Oh, you're not for bodily autonomy. No. Oh, you just condemn women who've had abortions. No. In fact, I've supported ministries that reach out to women because many times, and I can't testify to this for every woman, but I know for a fact there's a lot of women who went through an abortion and afterwards they were absolutely left alone to deal with the feelings and the emotions they were experiencing. Left high and dry. And there are pregnancy support centers out there who are trying to help those women. And I've seen this body attack those ministries. You're not for bodily autonomy. Oh, I am for a bodily autonomy. Every child's body in the womb. And every single one of those children's right to breathe air. I'm going to be a voice for them in this chamber. And perhaps if they did have a voice where they could speak to us today on this House floor, perhaps this is what they would say. For you formed my inward parts. You covered me in my mother's womb. I will praise you, for I am fearfully and wonderfully made. Marvelous are your works, and that my soul knows very well. My frame was not hidden from you when I was made in secret and skillfully woven together in the depths. And then it goes on to say, away from me, you who are bloodthirsty. I understand we're all accountable for the people in our districts, for how we're going to vote on this bill today. But I would just warn you that you're also accountable to the one who forms them in the womb. You're also accountable to the one who formed them in the womb. Please vote for life today, members. Thank you.
Further discussion on the repassage of Senate File 2995 is amended by conference. I recognize the member from Polk, Representative Keel.
Thank you, Mr. Speaker. And thank you, Representative Davis, for your message. I'm going to talk a little bit more about other things that are in this bill. Certainly, pro-life is always one of the things that concerns me, but life in general concerns me. Now, I know that this healthcare bill is very difficult. It's challenging, and I thank our lead, Joe Schumacher, for his efforts. But I'm really disappointed with the fact that the support of our hospitals did not happen in this bill. Most of my hospitals in my district are reliant on funding, which is not 100%. And COVID really did them in. It was really a difficult thing because many of our small hospitals do things that are extra, that provide specialty surgeries, whether it be a shoulder or a knee or a hip or those types of things. But during COVID, they were not allowed to do those things. I learned through a gentleman who had to go to the cities and get his shoulder fixed that our larger hospitals were still doing that. Said, oh yeah, and it was cosmetic surgery. Now, I didn't go into the background of it because I just don't know where he got the information from other than the fact that he was in the hospital doing that. But what I am very concerned about, extremely, is the fact that our hospitals are not going to get the financial support they need. And as I have spoken before on the floor, my urgent care, my smaller hospitals don't do everything. You go there to get stabilized so that you can go to Grand Forks or Fargo or even down to the cities. We have helicopter pads available for people to life flight. But I can tell you, I've ridden in those ambulances with those wonderful people that care for family. I've been in the front seat, and it took me halfway to Grand Forks one day to think, why did they tell me to get in? The gentleman in the back said, Mrs. Keel, get in the front. My husband was in the back. And I thought, normally they don't let you ride in the ambulance. But then I realized that he couldn't talk anymore and that he needed me to sign papers and agree with what he needed because his urgency was his kidneys at the time, even though he couldn't breathe either. And this was all before COVID. This wasn't COVID's issue. But I'm very thankful for my hospital to know what to do, when to do it. He spent 24 hours in the hospital before they could even find him a bed. All of this drama was during COVID, members. There's no beds, there's no this, there's no that. Guess what? That happened long before COVID. Our small hospitals can only handle so much. And Crookston, where I live, just built a new hospital, but they unfortunately had to shut down the nursing home, the memory care, because financially it wasn't working out for them. In this bill should have been, the hospitals requested it, should have been an increase in funding so that they could be a little more stable. I'm trying to think. I think I have 1, 2, 3, 4. Well, if I count Thief River Falls, I have 5 hospitals in my district. Now, that might seem a lot, but remember, I represent 3 counties plus. So, and Polk County is huge. It's, I think, 90 miles across. But the point is that this funding for my hospitals, or our hospitals, our rural hospitals, is super important. I'm sure Representative Howe and Representative Becker would agree with me that that ambulance brings you to one place. You are stabilized so that you can physically go to another if you need to. Otherwise, you are there, and thank goodness you're there because of the ability to diagnose what needs to be done. I'm really disappointed that we did not support the hospitals in this bill, that our rural health care is precarious at best, and the funding that it needs is very reliant on fundraising, also the ability to do small surgeries, mostly in and out surgeries. Rarely do you stay in the hospital anymore. When I was young, I worked as a nurse, CNA, or not I wasn't certified. I was a nurse's aide, and when we did surgeries, easily someone was in the hospital for 3-4 days for just a minor surgery that now we just treat and send home, which is kind of interesting when your husband has knee surgery and they get him up to walk 2 hours after knee replacement, and then they smile at you and say, "You get to take him home." Oh, great. And it worked out just fine. I made sure he took the meds he needed to. He made sure he had ice packs when he did. He kept me up a little bit for a few nights, but that's okay. That's just fine. That's the part of our life that is better, for better or worse, sickness and health, right? So I took good care of him, I think. I'm learning how good I did because now he's taking care of me. But the important part of this bill is that we look for services, support in our hospitals, because we can care for a lot of people at home. We don't need to go to the cities. I certainly appreciate the Rochesters and the university and all of those things, but let's face it, folks, a 7-hour drive or a quick flight, which I'm sure is at least an hour, from Crookston, Minnesota to Rochester is still a long time if you need that health care. You need something stable and something to stabilize you. Certainly with a heart attack, an hour is a long time. And Grand Forks is pretty good at making sure we take care of ourselves. But with the challenges of nursing services and the ability to do other projects, other services that we need in our health care, I'm just really wish that we had looked at doing more for funding for our rural hospitals and giving them the stability so that they can stay available and care for our rural citizens. Thank you, Mr. Speaker.
Further discussion on the repassage of Senate File 2995 is submitted by conference. I recognize the member from Hennepin, Representative Robbins.
Thank you, Mr. Speaker and members. I rise in opposition. I was originally going to speak in the beginning, and I'm just very sad to see this bill, the huge increase in the bureaucracy, the huge increase in spending, the idea of creating a separate department. I used to serve on the HHS committee, and originally when we first started talking about breaking up DHS, the point was to streamline things, there was going to be cost savings, and instead my understanding is we're getting actually 1,000 new FTEs, and there will be no reductions in staff, and huge new building or whatever is going to be needed for this new department. So every time we turn around, members, we are growing the budget and not providing any savings to the taxpayers. And that was the original idea. And so I have not served on the committee this year. I have not been in the weeds on some of these changes, but I know that was not what was originally thought about when we thought about trying to streamline the department, increase accountability, and provide some savings and efficiency to the taxpayer. And that's just one of the many things we could talk about in this bill. Also, you know, the issues of fraud and CCAP were not really addressed. The creating of the new stabilization grant, instead of funding families and children, it's changing the way we're funding childcare so that it's funding based on the number of FTEs. And I just feel like that's the wrong direction. We really should be going in a direction that empowers parents, that gives families more choices, that parents are directing the money, and that child care centers are funded based on the number of children they serve, not the number of employees they serve. So I just feel like there are a host of problems with this bill. Most of them have been much more eloquently spoken about by my colleagues. But members, with a 40% increase in the state budget, huge tax increases, nearly $10 billion in tax increases, creating a new department with 1,000 new FTEs, with nobody else being redirected or efficiencies created, that is just not what was envisioned, and it's very disappointing to see that's the outcome of this bill. Please vote no.
Further discussion on the repassage of Senate File number 2995 as amended by conference. I recognize the member from Douglas, Representative Franzen.
Thank you, Mr. Speaker, members. So regarding the Rare Disease Advisory Council, so there's going to have some significant challenges executing on its statutorily identified activities, friends. The governor did recommend full funding, and currently the Rare Disease Advisory Council will only be able to meet the compliance obligations of being a state agency and will have no capacity to execute on its mission. This is a disservice to what was put into place. The bill author apparently listens to the governor when it's convenient to do so, because the governor did recommend full funding. This bill, the Rare Disease Advisory Council, was heard in Representative Noor's committee. I do serve on that committee, and I think that we as a body should find that it's very dishonest to create a state committee and not fund it. Another thing I want to bring attention to is the funding for what the Democrats call as undocumented citizens or undocumented individuals. I like to say, refer to them as illegal aliens because they are here illegally. But we are funding in this bill to give them health insurance on the taxpayer dollar. $2 million of that funding comes from the general fund, and the rest is coming from the healthcare access. So that is $99,139,000 is coming from the healthcare access fund, which is a fee. That money that goes into the healthcare access fund is a percentage that we individuals pay on our healthcare bills. And now we're going to have taxpayers funding health care for those that are undocumented. I think that is egregious. This is becoming an extremely expensive state for families to raise their kids in. And the great start that the Democrats love to talk about is becoming extremely expensive. So I think we need to revisit this issue. You know, Illinois, in March of 2022, put into place a health care for undocumented immigrants or illegal aliens. They put in $200 million for this program. And now they are looking at about $1 billion that they will be paying for individuals. And this month, if you are paying attention to what is happening in Chicago, migrants from other countries that have crossed into Texas are being dumped into Chicago. They're having a crisis of their own hands. And Mayor Lightfoot of Chicago, as of May 9th, declared a state of emergency as the number of migrants coming to Chicago spikes. Members, when we put policies into place that encourages individuals to move into this state for our benefits, the taxpayers pay more. We, the state, is sending a message that Minnesota is open. Come on in. The taxpayers of Minnesota will fund you to be on health care, get driver's license. This is a bad precedence, bad messaging. Let's see, what else? The CCAP provisions in here. I can't say I don't disagree now with the increases of this bill because Minnesota is becoming so expensive. Providers themselves, childcare providers themselves, are going to have a hard time, even harder time, making ends meet for their businesses. However, there is zero accountability. We refuse to address the fraud in these public programs, and it's egregious, it's wrong, and taxpayers have a right to be very concerned. So I want us to pay attention to that. And then back to the great start. We made Minnesota an abortion sanctuary state, sending a message to children that they really are not wanted here in Minnesota. We've increased funding in this bill, in this really huge, heavy bill. We've increased funding to abortion providers while eliminating the positive alternative grants, which those grants help young mothers, families who are pregnant and need assistance. Yet another charities that the Democrats have decimated in this body. So friends, I think that we really do need to think about our priorities in this state, think about what a message we are sending to Minnesota's, to families. There's $17.5 billion surplus is what we had, which is now being just thrown away, just wasted away. And of that, we are raising taxes by over $9.5 billion. And we are funding, quote unquote, undocumented individuals in our budget. Families cannot afford what Minnesota Democrats are putting on their plates. It's an expensive time to be a Minnesotan. Members, vote no.
Further discussion to the repassage of Senate File 2995 as amended by conference. I recognize the member from Meeker, Representative Gilman. I recognize the member from Rice, Representative Daniels.
Thank you, Mr. Speaker. We've had a great debate on the floor today. I can't outdo my colleagues. They made some very passionate speeches. So my remarks will be very short. Chair Pinto, I thank you for your work. I know your heart is in the right place, and I enjoyed working with you this year. We have areas of agreement on the early learning scholarships, and I hope to work with you on more things that we might need to fix for next year. However, today I'll be voting no on your bill. The new Department of Children, Youth, and Families will lead to more bureaucracy and more regulatory control on our children providers. That's the nature of bureaucracy, which is right when enforced regulations. This bill fails to empower our parents and fails to focus on funding our children. The changes to MFIP are designed to keep people enrolled in public programs rather than promoting economic opportunities. Chair Pinto, I look forward to better legislation next year. Today I will no on the bill. Thank you, Mr. Chair.
Further discussion. I recognize the member from Wright, Representative Hudson.
Thank you, Mr. Speaker. Well, it's been a long debate, and a lot of what I'm going to say is in answer to the chairs, Chair Pinto and Chair Liebling. So we have to kind of roll back the clock a little bit today to remind ourselves of the points that were made there. But this, I do agree with Chair Pinto that it's fortuitous that this is the bill that we're hearing on the last day of session, because I think just the sheer scope of it, the fact that we're taking health and this new children and families concept and mashing them together in one giant omnibus, what that does is it affords us the opportunity to really take a high-level view of the governing philosophy that generated this bill. And it was stated earlier today particularly well by Chair Liebling, which I appreciate. I appreciate the authenticity. I appreciate the honesty in terms of what the goal is and the moral framing of it. The idea that health is a public interest, health care is a public interest, and that we're working to expand the scope that public institutions have in controlling that public interest. And it all sounds very benign. Phrases like deprivatizing our public programs, deprivatizing. I mean, there's a sense in which I could get down with that. Deprivatizing public programs. Let's look at our relationship with nonprofits. Let's look at the extent to which we grant public dollars to organizations that are controlled outside public scrutiny, to do with, in some cases, as they please, with little, if any, reporting required. That's an area we should probably look at, if that's what we mean by deprivatizing our public programs, but somehow I don't think it is. But at root here, I think we need to remind ourselves what healthcare is. Because when we talk about it in these terms, when we talk about it in terms of it being a public interest and subject to public scrutiny and public control, what healthcare is it's a service that is performed in relationship between doctors, healthcare providers, and patients, and their families. It's relational, and it's inherently private. It's inherently personal. We recognize this to some degree in the law with things like HIPAA, right? The inherent private nature of healthcare, the inherent private nature of the personal intimate details and the personal intimate procedures and goings-on that take place in the scope and realm of healthcare. You know, I think to when my children were born. I think to a incredible modern Star Trek style surgery that was performed on my son twice that has had the effect of basically saving his life. He has a very rare genetic condition. And they were able to, well, I won't go into the details, but they were able to do things that would not have been possible mere years ago. And that is personal. Despite the fact that I'm choosing to share it with you today, it is private. Those details aren't subject to public scrutiny, and they are not of public interest. There is no public interest in my son's medical case. That's a private matter. And what we see happening with this bill, and indeed with the governing philosophy that's produced all of our legislation this session, is an effort to displace privacy with what is euphemistically called public interest. And that's problematic. Because once an interest becomes public, it becomes political. You want to deprivatize, you want to take things, you find it gross or off-putting that outcomes are determined by economics, by money, by exchange. That's gross. Well, let me tell you what's grosser. When it's determined by a vote, when it's determined by an act of the legislature, when it's determined by a bureaucrat, that's gross. And that's what public interest is. You are displacing the private and the personal with the public and the controlled. And specifically when we cut over to, before I get to children and families, actually let's start with children and families and then I'll come back to this final point. The whole premise upon which this enterprise has been pursued has been an odd one to me. The idea, and was presented again going back to our first committee hearing when we heard a presentation from a pediatrician, the notion that we basically need to save parents from their children. I mean, it wasn't put that way, I'm definitely paraphrasing, but the idea that parents are just so burdened by the fact that their children exist and need care. And we need to interpose as the state. We need to come in and we need to interpose and make sure that parents spend much less time with their kids in those early years. That somebody else take care of them. And I've pointed out previously, when the disparity there, or the dichotomy between, on the one hand, making that argument that we need the state to interpose in the parental relationship in order to get parents out of the house and away from their kids so they can go make a widget somewhere. But then when we came to debating paid family medical leave, the argument completely flipped, and all of a sudden it's we need to figure out ways to get people out of their jobs, back home, to take care of their kids or to take care of their neighbor's dog or whatever situation that they're going to use and have signed off on in order to get them out of working that day. In either case, again, it's the state coming in, claiming public interest over a private matter, private relationships, private employment, private families' lives, and interposing, saying, this is how we're going to do things. Not the way you choose, and certainly not with your money. That's the other thing. Not with your money. And that's really, there's lots of problems with the new Children and Families Enterprise, but I think the biggest one is just the seeming refusal to acknowledge that the only thing we can do here in government is take and spend. We talk about tax and spend. Well, it's really take. We take and we spend. We don't produce things here. We don't make things here. This isn't a factory. This isn't a farm. This isn't a place where things get made. This is a place where things get taken from somewhere else where they were made, spun through a bureaucratic procedure, there's some skimming off the top, and then it's repurposed, redistributed out the other end of the system. And you can only do that to the extent that other people's money is available. And past a certain point, it won't be. And that might be the biggest problem with this. We talk about the investments. We're so proud of all the investments that we're making in all the various programs. Today, it's children and families, early childhood education. But the thing about an investment is that you actually have to make good on your pledge, right? If you sign a contract saying, hey, I'm going to commit to providing this year over year, you need to be able to sustainably do that. And I just don't see how we're going to be able to. You know, when we're looking at a state economic forecast before this session, before we spent all this money, before we spent the $17.5 billion surplus, before we raised taxes $10 billion, before all of that, the state budget economic forecast was flat revenue. And the idea that raising taxes is going to make that better, no. We're not going to get more revenue because we raise taxes. We're going to push people out. I mean, we've seen that dynamic in recent days and weeks with a major employer in this state who managed to get their problem solved through, I believe it's actually in this bill, isn't it? Got a little carve out? Or that's another one? Okay. Okay, right. So it might be coming later. But that's what's going to happen. I mean, your employers, your businesses are telling you, we're not going to lay down and take it. Because they're the ones who are actually making the things. They're the ones who are actually producing. They're the ones who are actually providing the care. And so merely saying you're going to do something isn't going to make it happen. Legislation isn't magic. The money needs to come from somewhere. And you know, when you take away the private interest and replace it with the public interest, what you eliminate in that process, one of the things you eliminate in that process is care. Caring what happens with that money and whether or not it is efficient. And we saw a demonstration of that in 2019 with the CCAP fraud, which we're doubling down on in this bill, tripling down on in this bill, $100 million in fraud that investigators agreed was the extent of the CCAP fraud, $100 million. Now, that's the kind of thing that if it happens in the private sector, people notice. They notice when $100 million goes missing. We didn't notice as it was happening. Happened again a couple years later with the Feeding Our Future scandal, which has a nexus, a crossover with the provisions of this bill. We're not saving any money. There's no incentive to save money because it's not ours. We're going to take it from somewhere else. So what reason do we have to be thoughtful in terms of how we spend it? And so what are we doing? This has been characterized as a consolidation. That word has been used. We're consolidating departments to create a new one, different aspects of departments to create a new one. But, you know, oddly enough, you know, if it was a consolidation, you would expect some efficiencies, right? We're going to perhaps shed a few FTEs. No. Not one person, not one position is going to be lost in government as a result of the creation of this department. In fact, there's a provision in here to just ensure that nobody loses their job. We're just going to add, more bureaucracy, more FTEs, more government employees. That's going to solve the problem. And, you know, the whole thing is rooted, and again, you know, looking at that higher level view of the governing philosophy that has informed our legislation this session, it's all rooted in the concept of equity. And, you know, as I've pointed out before, if there's some place we want to look for an example of where equity has finally and eternally been achieved, it's the graveyard. That's where we get there. When all activity has ceased, you finally have achieved equity. And that's how this is going to play out. To the extent that we keep pushing towards all outcomes being equal for everyone, the way we're gonna achieve that is by churning down the activity. That's what happens when people pick up their investments and they leave. When they take their businesses and they close them, they put a going out of business sell sign on the front door. When they do that, that is your activity ceasing. That is economic death. And that's the direction that we're headed. But one final point I want to make regarding equity There's been a lot of talk today about abortion and the provisions in this bill that I think shamefully remove some of the final protections that remain in statute to protect the unborn. It really makes me question the allegiance to equity that is often stated in this chamber. And what I want to do here is I'm kind of holding you to your own definitions, right? Because we're told time and time again, indeed, for justification for this bill, that we need to recognize systemic disparities, systemic racism, that we recognize. How do we know it exists? Well, because of the statistical disparities. Because certain systems, certain programs, certain ways of living have a disparate impact on this group over that group. From the Pew Research Center, citing CDC data, and by the way, let me just pause to make the point that this type of data on abortion, is something that is going to be skewed as a result of this bill. We're not going to be tracking these numbers anymore. So it's best to appreciate this information while we have it. The CDC says that there were 620,327 abortions nationally in 2020. That's the District of Columbia and 47 states. Of that number, in the District of Columbia and the 29 states that reported racial and ethnic data, because they don't all do that, they don't all break it down by race, 39% of women who had abortions in 2020 were non-Hispanic Black. 39%. Non-Hispanic White was 33%. Now, for some context, the census tells us that 75.8% of Americans identify as white only, and 13.6% identifies Black only. So you're talking about, in terms of disparate impact, Blacks are more than double represented, about 2.5 times above the white population when it comes to victims of abortion. I can see you're really concerned. This is how I know that the rhetoric surrounding systemic racism may be less than genuine. Because if the mere existence of disparities in aggregate statistics means there is, in effect, systemic racism, then you would be hard-pressed to find a greater, more prominent, more deadly example than the status quo of abortion in this country. And this bill furthers that. You started the session with a bill that furthered the killing of children, which by your definition is systemically racist, and you're ending the session with a bill that furthers the killing of children through systemic racism in the form of abortion. But it's all for children and families. We're making this the best state in the union to raise a child, to bring your kids, unless you don't want them, in which case we'll help you get rid of them. This bill takes out the provision that requires life-saving care to be given to a baby born alive. Yeah. But I'm supposed to believe you when you say that it's all about the kids. Vote no.
The member from Anoka, Representative Niska.
Thank you, Madam Speaker and members. We've heard a lot this session about how this is a historic session. It's a transformational session. And that's true. Certainly is transformational, certainly is historic. I will remind you when you're saying that, that's not necessarily a good thing. Disfigurement is transformational. And there's a lot of that going on today, but I wanted to just recognize this day in history. May 22nd, 2013, because I think this is a historic day. This is a very historic day. I think today marks the final nail in the coffin, the final blow to the concept of the Democratic Party as a pro-choice party when it comes to abortion. I think there can be no mistake as we finally pass this last in a trifecta of bills on this topic that the Democratic Party is now an unapologetically pro-abortion party. We're raising funding for abortion while we're eliminating funding for the Positive Alternatives Grant Program, something that we used to fund on a bipartisan basis, that would just provide funding for those clinics that wanted to provide information for women who wanted to make a different choice. So we're reaching out into that marketplace of ideas again, and to those women who are making a very, very difficult choice, a choice about a very difficult and emotional topic, about whether or not to continue with the pregnancy, sometimes with very difficult circumstances. Sometimes there's health issues with that baby. Sometimes there are other difficult family circumstances. But we're reaching into that marketplace of ideas and we're picking one side. We're funding one side and we're cutting funding for the other side. We're eliminating the data collection on this issue. You know, it was interesting, I heard Chair Liebling talk about how important it was that we're funding studies about a lot of important issues in this bill. We're funding important studies so we can gather more information to help guide potential future public policy decisions, but at the same time, we're eliminating data collection on this issue. Apparently, we no longer want to know whether abortions have resulted in born alive infants. We no longer want to know the reasons why women have chosen to make that difficult decision. We no longer want to know whether any medical actions were taken to preserve the life of a child who was born alive. And shockingly, we no longer want to know if a woman dies within 30 days after an abortion. Why would we want to know that? Why would we want to shape future public policy decisions on those issues? I think we know why we're, as a state, covering our eyes and ears to that kind of information. And we're taking away some pretty clear and important language that was passed, again, in a bipartisan fashion to protect those infants who were born alive as a result of an abortion. Now, members, I know that many Minnesotans have a variety of opinions on this issue, and it's, like I said, it's a very difficult, emotional topic. There used to be, at least both parties used to recognize at least a bipartisan, nonpartisan recognition that every abortion is a tragedy. And the fact of the matter is, every abortion is an act of violence in some way, a poisoning or a dismemberment of a human body. And we can agree and have, I think, difficult discussions about the circumstances in which that might be justified or even permitted in law. But we're past that now. On May 22nd of 2013, we're past that. And it's very clear from House File 1 to the abortion sanctuary law to today, we're past that in this state. It is a historic and a transformational day, but not one in which any Minnesotan, I think, should be proud. Please vote no.
The member from Dakota, Representative Ryer.
Thank you, Madam Speaker. I am so happy to rise in favor of this bill because it centers the reality that health care is a human right. And it calls out that the reasons that we need to make changes is because we fall short for so many people. Yes, many of us have access to excellent care from the excellent care providers that we have in our state. Too many people have virtually no access to care. And our Black and brown communities, especially Black women and children, face unconscionable disparities. Now, all of these are policy decisions and business decisions, and they can be addressed, and that's what we're doing in this bill in so many ways, and I'm pleased to take a moment to tell you about some of them. Some of them are problems that we can fix right now for the people within the system that we have right now. For example, a bill that I've carried for 3 years now on opening network access for people with rare diseases, especially children, taking out an unnecessary barrier to care for people who need it the most, and saving children months and months of incorrect treatment, of inadequate treatment, or no treatment at all. We've increased reimbursement rates for doulas, going from $47 for a treatment to $100, going from $488 for a birth to $1,400, and making it possible for these care providers to help the Black women and other mothers that they so often help have a healthy outcome. We've established a process where hospitals are required to provide information to patients to make sure that they are not unnecessarily incurring medical debt, leading to bankruptcy in too many cases, the stress of having that debt, and sometimes the inability to get more care because until they've paid their bills, they might not be seen. All of these are immediate fixes. But I'm also looking at how do we fix it for the long term? How do we get at the root causes? And some of them are simply the dysfunctional structure of our healthcare system. We've heard today about, I'll call it the sanctity of the patient-provider relationship, and how we don't want anyone to get in between that, certainly not government. But let me tell you right now, the health plans are in between that. The patient and the provider making the decisions. Pharmacy benefit managers are deciding what drugs people can have. There are so many barriers and so much complexity and so much inefficient use of money in the system that we can fix by thinking about how could we design it better. What can the data tell us about how we can do it better? And those are some of the things I'm really excited about in this bill. The studies that we have in there. For example, studies on what are the actual drivers of cost in the healthcare system, from the individual doctor, sure, but into the care systems in the administrative branches, the health plans, the pharmacy benefit managers. What are all the different pieces that add cost? Where are the inefficiencies? What can we do about that? How can we have different models of payment and reimbursement that work better for the providers and also for the patients? And I have another bill that takes a look in a more comprehensive way than I've seen anywhere in the country on universal health care versus our current system. It goes in with a very agnostic, very data-driven point of view, because I am a researcher by profession, and I will go in and say, here are the hypotheses, and how do I disprove them? How can I kick holes in something that I would really like to see be true? And that's what a researcher does. So we'll be looking at the cost of the administrative aspects of healthcare for businesses who tell us that they can't afford to provide health care, small businesses who spend 40 hours a year picking and administering their health care, corporations that hire hundreds of people to manage their care, providers who have staffs sometimes larger than their care staffs to take care of payment and insurance and reimbursement. We're looking at all those costs, and we're also saying as an assumption that we're not tied to the Medicare or the Medicaid reimbursement rates. So the argument that we can't afford to go to universal health care or other models of health care simply are not valid, because those are policy decisions too, and those are things that can be changed. So I am very, very grateful to Chair Liebling for your leadership on this and your support for these ideas, and to the committee and all of the people who helped me strengthen these ideas, including people on both sides of the aisle who have challenged and raised questions and raised issues. And I don't see him here, but I would call out in particular Representative Nadeau, who always has a thought-provoking question, and I thank him for that. So with that, I would say let's take this opportunity to design the healthcare system that can benefit everybody, not taking away from anybody, but enriching the system so that all have the benefits that we all deserve. Thank you. Please vote green.
The member from Anoka, Representative Scott.
Thank you, Speaker Hortman. And members, I know we've talked some today about the issue of abortion on the House floor here, but I just wanted to hit on one specific area, and that's late-term or partial birth abortions. And I just want to kind of give you an idea of what Minnesota might be in store for them based on the extreme abortion stance taken in this bill. And we heard this a few weeks ago when some of the other bills were on the floor about just the Infant Born Alive Protection Act and so forth. And it was stated by members of the other side of the aisle that that just didn't happen very often. And I just want you to know that since the legalization of Roe, 85,817 babies across this nation have been born alive. They've survived abortions. So this does happen, and I think it happens a little more frequently than the members of the other side of the aisle would like to admit. And right now, there's a state that's very similar to Minnesota in their abortion laws, and that's Maryland. And I have an article here that talks about partners in abortion care in College Park, Maryland, and they plan to sell abortions all the way through the third trimester. They said that they plan to offer abortions through 34 weeks of pregnancy, long past the point of viability. Members, babies have survived outside of the womb at 21 weeks. That's very common with modern technology right now. So this group, and this is what Minnesota's inviting into our state by being a sanctuary state, and one of the owners of that abortion clinic that's moving in suggested that she, comments suggest that she will abort late-term abortion babies, unborn babies for any reason, including healthy unborn babies and their healthy moms. So not even a medical reason to abort the child, just the mom changed their mind in the third trimester. And members, later term abortions are also more dangerous for the women. So I think it's really important that we think long and hard about what we're doing here in the state of Minnesota. It's not okay when you have a viable baby to just snuff its life out in a very, as was mentioned already, violent way. And members, now I want to switch gears here a minute to an issue that I've cared about here in the legislature for some time, and a very respected member, former member of the legislature, also cared a great deal about, and that was Mary Liz Holberg. And she was very devout on this issue because she'd had mothers that had given their babies up for adoption back in the days before Roe versus Wade, and they were promised that their names would not become public, and those adoption records would not become public. And so with this bill, it contains a provision that wasn't heard in the House this year. It was given one hearing in the Senate, and I've heard that members of the other side of the aisle that were on the decision-making process on this bill were just tired of this issue and they wanted it to go away. But members, I'm talking about a time when there was no legal abortion, when there was no reliable birth control, there were no domestic abuse programs, incest wasn't discussed, and birth of out-of-wedlock babies was shameful, and the women were rejected if they had these babies. But Minnesota made a promise to these women back then that those birth records would be sealed, and this bill is unsealing that. It's breaking a promise. You know, the other side of the aisle, if you want to argue on Roe, and Roe talks a little bit about this right to abortion or privacy, and what we're doing here is contrary to that. And I think it's really important to point out who came together, what coalition of people came together to keep these birth records sealed. Opening the birth records was opposed by the ACLU, the MCCL, Lutheran Social Services, Catholic Charities, and the Star Tribune editorial board. The former director of the ACLU said that we need to respect women's rights to choose. So these women chose to give their babies up for adoption, risking a lot, risking shame. A lot of these women were stowed away somewhere. They were taken somewhere out of state or to some other part of the state that no one knew who they were or who their families were. And they gave birth to these children. And then they were able to give them up for adoption. And these children went to homes that wanted a child. You know, there's so much genetic testing. We had the genetic, that bill this year that talked about these genetic companies, the 23andMe and those so forth. And so we've regulated those. And it's just not that hard these days to go through that kind of a process and find out who you might be related to. But what we need to do in this state is we need to keep our promises. When we make a promise to someone, whether it's a woman that gave her baby up for adoption or some other promise that this state has made, it's really important that we do as we say we're going to do, as the law says. Members, for this and other reasons, I encourage a no vote.
The member from Ramsey, Representative Perez-Vega.
Thank you, Madam Speaker, and thank you to Chair Liebling. As I continue on to speak, I have to really recognize the undocumented Minnesotans. And I'm not going to apologize on behalf of this whole body because I know which body I stand in respecting human rights. And healthcare is a human right. And I have heard in my first session, in closing this session, the continued insults of words towards the strongest community that has uplifted us in some of the hardest times that we have been surviving in. Pre-pandemic, post-pandemic. And I think about all of our children, regardless if you're born with a social security number or not. As a child that grew up and is continuing to live with a chronic illness that is managed by insulin, I think about the privilege that I had as a Latina, as a Puerto Rican, born in this country, or even as fellow Puerto Ricans that are citizens that came to this country like my family, we still had accessibility to Social Security numbers. And it was always just like, why doesn't the other side of my community have this? Whether they are the largest immigrant community of Mexicans and the other Latinos that came by way, such as my family, to this state, or the second largest immigrant community of the Somali community that we have members of this body who refuged. Everyone should have accessible health care just like us with the Social Security number. We're talking about accessibility of universal health care, and we're starting universal action in this body, and that's something that I'm proud of. And I'm proud of the advocacy of our undocumented community that has had to be listening to these titles that are given to us by people with privilege who have no idea what it is to be insulted when you are not noticed as a human being and called an illegal. I'll tell you, we're standing on stolen land. We're standing on indigenous land. I have sisters in this body. I have cousins in this body that will continue to say that and remind us the privilege that we have as being here in this state, and now our undocumented human beings of felicidad y celebración are going to feel a sense of liberation when they say, Maria, we don't have to call you to see where is it accessible to get insulin so our kids can live like you. So that we have accessibility to doctors who want to provide and share, but we live in an unjust system of healthcare that says, I'm sorry, this is the last of the route into where I can legally take you. I am grateful for the leadership in this body. I'm grateful for our majority leader and mentor, Jamie Long, for his hard fight, and our speaker for her hard fight and dedication to telling our comunidades, our communities.
Point of order, Madam
Most
Speaker.
important, Tina, you, for telling me that. Remember, kid, when you were fighting for insulin for all and you said it didn't include all of us?
Representative Engen, please state your point of order.
Section 124, Masons, personality is not permitted in debate. In debate, a member must confine remarks to the proposal before the House and avoid personalities.
Representative Perez Vega.
Thank you. Representative Tina Liebling, for you telling me, hang in there alongside one of my mentors, Rep. Mike Howard, when I was testimonying saying this isn't including all of our community because they're at my door. They're my friends. They're my best friends. They're my god kids, and they need insulin too. And you taught me about the policy of this is how we make action and take action. And one day when you're seated with an elected certificate, you take that action, and we're taking that action with law that we're reading here when folks with an ITIN number can go get the same benefits that we have right here, whether we're citizens or not. Because let me remind you that $12.4 billion of Minnesota's spending dollars, according to the Minnesota Chamber, is spent by our undocumented community here. The ones that are cleaning up the hospitals, the ones that are cleaning out those sharp needle tanks that I see every time I give insulin in this place right here, are folks that have came from other countries that love this state and that are celebrating here in this session. And this health care with our children and families and being inclusive, Representative Keeler, Representative Pinto, those long discussions of what we talk about, what equity looks like for not just one group of Minnesotans, but all of Minnesota is right here. And it's a start. There's so much more. And when I think about the leadership of Representative Ruth Richardson, who is continuing to stand up for the rights and black maternal rights of our mothers, these numbers don't lie, y'all. We all are here studying numbers. Some of us are just ignoring them. Well, you can't ignore the truth. And you can't ignore the facts that Minnesota is a place welcoming with this healthcare initiative taking action. I urge a green vote. Thank you.
The member from Chisago, Representative New Brindley.
Madam Speaker and members, this is quite a bill. This is quite a bill, and I'm going to just hit some of the highlights. because frankly, in 800 and some pages, I don't have time to hit all the, maybe I should call them the lowlights. But when it comes down to it, this health bill, these 800 and some pages, show you exactly what the extreme activist agenda of the Democrats is. And I'm just going to hit on a few that are particularly egregious. The first is just this timeline. If the DFL, if our Democrat counterparts go through with everything in this bill, and I will put a finer point on some of this in a minute, in 2027, this is what's going to happen if the Democrats go through with everything that's in this bill. Medicaid and Minnesota Care will no longer be under managed care. They will be completely fee-for-service administered by the department. This, as you can imagine, this would require a massive growth in DHS to make that happen. Minnesota Care would be on the exchange and open to anyone with any income. And I want to point out just briefly why that is such a problem. We've talked about this in the past, and frankly, I assume that this is why it became a study and is not in the bill yet, but would be by 2027, according to the timelines laid out. And I'm going to make this really simple. Here's what it costs to provide care. Here is what Minnesota Care pays. See how that's lower than what it actually costs. Here is what Medicaid pays. It's lower than even Minnesota Care. Here's the cost of care. Here is what private insurers or managed care organizations pay. So what happens is managed care organizations, private insurers, subsidize the cost of Minnesota Care and Medicaid. Subsidize those payments, I should say, to the providers. So you can imagine that when we go to this Minnesota Care buy-in, that's going to cause real problems for providers when they are now primarily being reimbursed at significantly lower rates than what the actual cost of care is. This is not magic, this is just math. This is just math. Again, and another piece of this, reinsurance is defunded in this bill. The account that pays for reinsurance is being completely wiped out. Again, this is a program that not only stabilized the insurance market in the state of Minnesota and ensured that every Minnesotan had a choice in how they pay for their health care, but it also actually decreased rates. It decreased the cost of health care for the consumer. I'm not talking about for insurance companies, for pharmaceutical manufacturers. Reinsurance is one of the very few programs that has come out of this legislature that has decreased costs for the individual, for the consumer. And this bill zeroes that out. So these are some of the things that will happen by 2027 if we follow the timelines that are in this bill. Now, I can only assume, based on what's being done here and what has been done in other bills already, is that Democrats hate any business regardless of the service they provide. It doesn't matter. We just hate them and we're going to stick it to them, regardless of the service they provide. So let's talk about the elimination of managed care in this bill. To be very clear, while it became a study, this is more than a study. This is an implementation plan for the elimination of managed care. And frankly, I don't really get it. I'm glad that we finally acknowledge that we do need a study, that we should actually have an actuarial analysis to move forward with this. I'm glad we at least figured that out. Because every single independent study, every single one of them, shows that with a managed care organization, you get higher quality health care at a lower cost. Every single independent study. Every one, you guys. But we're going to move forward. Interestingly, this is what Medicaid.gov says. I looked this up on Medicaid. It says, by contracting with various types of MCOs to deliver, and MCOs is a managed care organization for those who don't live in the healthcare world. By contracting with various types of MCOs to deliver Medicaid program healthcare services to their beneficiary, states can, again, this is from Medicaid, states can reduce Medicaid program costs and better manage utilization of health services. That means people are accessing health care more under managed care. Improvement in health plan performance, health care quality, and outcomes are key objectives in Medicaid managed care. This is what you get with managed care. Now, interestingly, we heard a representative a few minutes ago say that health plans are in between patients and providers. And I want to say that's true. Because do you know what the MCOs do in the state of Minnesota? They provide a really important service in between patients and providers. Because the way this is set up in the state is that there's a holdback, right? The state of Minnesota contracts with insurance companies. We call them managed care organizations. They're insurance companies. The state of Minnesota contracts with insurance companies. And the insurance companies are required to meet certain criteria to get paid. I mean, now, of course, they get paid for some services, this kind of thing. But the state of Minnesota actually holds back some of their contracted funding until they meet certain benchmarks. The insurance company has to show that children are receiving their immunizations. The insurance company has to show that people are receiving preventative care. Insurance companies have to actually show that they are making progress, that they are making sure that people are receiving health care in order to get that payment that has been held back. These are financial incentives to the insurance companies to make sure that kids are getting their immunizations, that people are going and getting their checkups. So yes, insurance companies are between the patients and their providers. And the insurance companies are the ones that are sending out the letters, that are calling families and saying, hey, you need to go get your immunizations. Your 2-year-old is ready for their next round of immunizations if they haven't received those yet. The insurance companies are doing that. Because if they don't, they're not going to get paid. So yes, you're right. The insurers are between the patients and their providers in a really helpful way that improves health outcomes for Minnesotans. And I guess, and we should ask ourselves, will the state of Minnesota, will DHS do the same? I don't know. That's not really known. You might hear that, these insurance companies are making so much money off the backs of Minnesotans. Their margins are so huge, they're making so much money that we got to stick it to this big business. Well, I'm not sure if you're aware, but actually in the state of Minnesota, it is mandated. They don't get to make big margins. If they do, they have to return that money to the state of Minnesota. So this idea that somehow these insurance companies are getting rich off the backs of Minnesotans, no, they are getting paid for the service they're providing, and if they get paid too much, they have to give that back to the state of Minnesota. It's in statute already. It's already there. It's a red herring. Let's talk about the public option, the so-called sort of Minnesota Care Buy-in. Although we've talked about the Minnesota Care Buy-in, the study in this talks about other public options. So I don't know what for sure those would be, but perhaps other public options. Now the study on this one has to be done in the next 9 months. We need a report on February 1st of 2024. We got 9 months. So we've got 9 months for the agency to contract with actuarial firms, so to go through the RFP process, sign contracts with the actuarial firms. Then the actuarial firms have to actually do the analysis. I wish Representative O'Driscoll was on the floor. I bet he would have some insight in how long this might take and what kind of a process this might be. But the actuarial firm has to do this in-depth analysis. The agency has to compile the report to give back to the legislature with these detailed recommendations for implementation. And not only that, not just recommendations, but they have to have actual draft legislation. Draft legislation. And all of this is going to happen in the next 9 months. I mean, listen, I may have been born at night, but it wasn't last night. 9 months to get this done? Like, that's silliness. That's not going to happen. And interestingly, this bill doesn't just include a study, it's actually implementation language. On page 705, the commissioner, regardless of what the legislature chooses to do, the commissioner is directed to receive a waiver for the public option or apply for the waiver. So all of this creates pretty significant problems. This bill also includes what I would call another hidden tax. In addition to an $18 billion budget surplus, in addition to $10 billion of new taxes and fees, this bill includes a real hidden tax on families, and that's through mandates. There are a ton of mandates in this bill, and the estimates are that annually, that's going to cost a family of four somewhere between $900 and $1,300. This is yet another hidden tax on families. I have never seen a budget like what the Democrats are passing right now. Because there are the very clear and laid out tax increases, I get that, but there are a ton of things that aren't an actual cost to government. And those things don't show up in the fiscal notes. Those things don't show up in the fiscal analysis. But they sure cost families a heck of a lot of money. And I'm going to be horrified when that analysis of this budget is finally done and we know the real impact on families. Because members, what we are doing to families with this budget is unconscionable. And this is just another piece of probably about $900 to $1,300 a year per family of four to pay for the mandates in this bill. I want to talk just for a minute about the changes in law governing abortion policy. We're no longer reporting, Representative Niska went through quite a bit of this, and I appreciate that. But we're no longer going to report on things like the reasons for having an abortion, whether somebody has been raped or involved in incest, whether the person is choosing to have an abortion for economic reasons. I actually think that's really important from a public policy perspective. If there are people in the state of Minnesota who are choosing to end the life of a child because they can't afford it, that's important for us to know as lawmakers. That informs what we do. That informs the policy decisions that we make. Emotional health. There's a lot of things on this list that are important to policymakers. We should have this information to make the best decisions that we can. We heard a lot in committee, or I heard over and over and over again, on the Born Alive Act, the infants who are born alive. And what we kept hearing is, well, that never happens. That doesn't actually happen. If I had $1 for every time I was told, that doesn't happen. By the way, told in committee by the Democrats that does not happen. Well, you know why we know you're wrong? Because there's a report that tells us that just last year, 5 babies were born alive. And we know that because we track that data. But this insistence on, well, if I don't see it, if I don't hear it, then I don't know it. Then I don't have to be held accountable for knowing it. It's gross. That's gross. And along with eliminating the positive alternatives for abortion grant program, this one is really peculiar to me. You know, we've got an $18 billion budget surplus. We've got $10 billion in new taxes and fees, and yet we're really nickel and diming. We couldn't possibly find the $7 million we need in a biennium for the positive alternatives grant funding. And let's be really clear about what this does. When we are pinching our pennies and eliminating the positive alternatives grant money, what we are doing is we are taking money from these programs that are buying diapers for new moms, that are buying car seats for new moms, that are buying formula for new moms who cannot otherwise afford it. And by the way, 60% of the recipients of the positive alternatives grant money are people of color. 60% are people of color. 70% are single moms. Representative Niska said it exactly right. Democrats are no longer the party of pro-choice. They are the party of pro-abortion. They don't want anyone to know that there is any other option, that there is perhaps any other way, that there are programs in place and people ready to help you if you want to have a baby, if you want to keep your child. When you eliminate all the reporting, when you eliminate having Minnesotans even know what's happening, along with eliminating funding for people who are helping those who choose to have their baby, you are no longer the pro-choice party. You are the pro-abortion party. This bill is as extreme of a health bill that has ever come out of this body. This is the most extreme, activist-driven piece of legislation to go to the governor's desk. It's wrong. It's wrong. And a lot of the pieces in this bill are not just wrong, it's disturbing. And I sure hope that you will find your moral compass before we hit our buttons and vote no.
The member from Ramsey, Representative Pinto.
Thank you, Madam Speaker. Well, members, at the end of third reading, we generally are responding to points made during the course of the debate, and of course, we've had a little bit of some back and forth because we have the multiple bills combined here. And I guess what I didn't hear from the other side and the children and families side of the bill were expression of concern about the investments in shelter for people experiencing homelessness. I didn't hear concerns about the investments that we had in food security for families, investments in our child welfare system, especially supporting those exiting foster care, the young people. I'm so glad to hear that. I didn't hear objections to the investment making tribal communities. and all that. So I'm very grateful for that. One element that I did hear, one theme, was continued expression of concern about the Child Care Assistance Program. And I'll admit, as I've said before, to continue to be pretty bewildered by that. There were some reports 5 years ago about that. 4 years ago, we had a series of reforms advancing through the House. I think I've handed out the sheet, one-page sheet, maybe eight times now, describing all the changes made in that program in 2019. And recognizing that even now, the allegations at the time, 4 or 5 years ago, were in fact largely debunked. So I guess I would ask members for us to recognize that it is perhaps time to put that to bed, and to recognize that our Child Care Assistance Program is serving families and serving communities in every single one of our districts. And as I've said before, doing so more in greater Minnesota, in fact, than in the Twin Cities. I've heard concerns along the way about support for family child care providers who do incredible work. And members, I want to make sure that you recognize that there is so much in here for our family child care providers who are hardworking, including the Child Care Assistance Program, as I referenced, but a number of other things for them to have their business be supported and have them be supported, including their eligibility for the monthly payments I referenced before, recognizing this is a public good that needs public support. But more broadly, members, what I heard was a difference, and I guess this, again, it's good this is the very last day of the session, because what I heard is a continuing debate about kind of our governing philosophies, about kind of how we believe that our state can prosper. I have heard, again, both in this debate and in others, references to the idea that there are certain people who are the people who are about wealth in our state. They're the generators of wealth. They bring wealth around. They're the job creators. It's them. And that everybody else, I guess, is somehow a taker. That somehow when we offer support to people, well, my goodness, folks are going to be flooding in from elsewhere, are going to be draining and taking money and taking support away from the rest of us. And members, I have, and I think my colleagues on this side of the aisle have a very different philosophy. When we empower people, our state does really, really well, as we've talked about before. When we provide, when we ensure that people can be with their babies when they're born through paid family leave, thank you, Representative Richardson, for her work. That's something that's going to make a really big difference for that child and going to make a difference for all of us later on. When we reduce child poverty through the tax credit that many of you voted against the other day, we do that by 1/3. That, in fact, makes a huge difference for all the rest of us. That is something that's going to be encouraging of parents and going to be encouraging of all the rest of us as well. When we invest in education and housing and transportation, when we make those investments, members, that is something that, in fact, empowers people, and we are all better off. And that certainly includes those folks in our community who are undocumented. You heard the reference before, more than $12 billion generated in our economy from people who are undocumented. When those folks have health care, when they are involved in our community and empowered to be in our community, that makes a big difference too. And members, to my mind, that is the philosophy then in the children and families side of this budget. That when we make sure that the kids and their families, if they're experiencing homelessness, that they actually have a stable place with a roof over their heads, that they have the food that they need, they have the safety that they need, that parents have the child care that they need so they can go out and pay the rent and pay the expenses. There were some comments made about, we're somehow taking something away from parents. Members, I mean, I'm not sure who you're talking to. People are struggling out there, right? People need to work in order to pay their bills. Now, we want to make sure they can be with their families, with their babies in the earliest weeks of life. That's why many of us voted for a paid leave program that allows for that. And then folks, unfortunately, because of the structure of our economy, need to get out there. And so when we provide child care, provide support for child care, just some support, that then allows parents to be in the position to take care of their families, to have their kids do well, to have all the rest of us do well, to deal with the worker shortages that we have in our economy, to do all that's necessary there. Members, the children and families portion of this budget does in fact help get so many more kids off to a great start. I am so excited to be supporting it. I'm grateful to my many colleagues who have contributed to that work, grateful to the partnership with Chair Liebling, and I would strongly urge a green vote. Thank you, Madam Speaker.
The member from Rock, Representative Schumacher.
Thank you, Madam Speaker and members, and thank you to the conference committee that put this together, and particularly to Representative Liebling for her leadership in getting this across the board. I agree with very little that's in this bill, but do appreciate just the lift that does require in that whole piece. And I know just from the conversations I've had recently with Representative Liebling, she knows her bill and what's in it and the reasons that they're doing the things they're doing, which I also very much appreciate. So thank you for that. I will say that this bill looks a lot different than it did when it left the House. I do sincerely believe that a lot of that came from the conversations that we had on the floor about the concerns that we had with especially some of the carve-outs and the move to the public option before we had the information there. And I'm glad to see that those thoughts came into the conversation and what we ended up with afterwards. This was a year where anything that was proposed could have been sent through and passed and sent to the governor for signature to become law, but we saw some of that scaled back to get the good information that we need, including on the Minnesota Care buy-in, so that we can find out what those premiums would be and to know what reimbursement rates would be and how that will all work. The same thing with the 340B study, in trying to find an earnest approach to how we really address that, and do we need to make changes to it, and how do we get more information and the dollars from that figured out, but not doing it right now in a way that was going to potentially impact hospitals and other pharmacy groups along the way, but to figure out a way to do it and do it the right way. So I really do appreciate that there's been a step back from that. And as well with the Healthcare Affordability Board and trying to find a way to get peace in the valley on that. That's my understanding, is that the language in here does have peace in the valley for that. I do have some questions on the Center for Healthcare Affordability and how that will exactly function. I'm not going to ask them today, but just as we move forward and look into that, particularly on lines like 684.19, that the the center may convene an advisory board, but it's not required to, and that they're required to offer periodic reports, but no definition on what periodic is going to mean in that. And so we'll be interested in learning more about that. I'm sure we will next year as we move along in there. There are some good provisions in the bill that I just want to touch on briefly here. The 3% increase to the rates for adult mental health, that's crucial out of this. And even when I was back home for different events in the weekends, and people would ask for a legislative report, and my folks are a little more conservative. They'd ask what good was going to come out of this legislative session, and I said, well, we should see some changes in our mental health arena and how we're able to function with that, because we have the money to do it this year, and there was a real priority, and we saw that with the pieces in this that we have here. Treating Alzheimer's as a public health issue is also going to be vital as we look towards the future, and not only the aging population, but those who can be affected by it and the costs associated with that. To treat this like a public health issue and really call attention to it is going to be helpful. The same thing with drug overdoses, changing that and making perspective on that as a public health problem that we have in this state, and addressing it from that angle is going to be helpful. Also, returning the benefits of adult dental. Dental is another issue that perennially comes around as something that needs to be dealt with, and this is one area where we have seen some improvement. And I really have to say that I like the value-based drug purchasing and some of those pieces. Getting manufacturers and providers of medical support to actually have a stake in the game with what they're providing there is going to be really helpful as we move forward and talk about different ways to provide care and pay for that care in the future. Getting people to have some value and have that in there is going to be helpful. I do have some concerns, though, as we move forward with this bill, and a lot of it we've talked about and heard about from many people on the floor today. Of course, the changes in the language on abortion is a concern of mine, but we've adequately addressed that, I feel, in the discussion today. Funding removal of the positive alternatives is another area. We talked about the fetal death records, the certificate of birth. I'm still trying to figure out all of that information, as well as the adoption reporting pieces that we have there. Just still trying to figure out some of those parts. I was sorry to see that the House wasn't able to maintain their position of having general funding for the 811 program, and so we'll see that turn into a tax, but I know that was a strong position from the House to try and keep that so that we didn't raise more fees on people at a time when we have $17 billion budget surplus. There are some concerns with the Minnesota Care expansion for undocumented immigrants. I've been asked before how you are able to do, how anyone would be able to do both expand their immigration laws or abilities to be in the state as well as provide a deeply subsidized health care, and just how that balance ends up. I've never been able to figure out how that works. I know Representative Franson made points to that too in her remarks. Maybe I'll find out after a couple years with this program in the state. I'm optimistic that if it's going to happen, it should be successful. And so we would like to see that. I do have concerns as well with the hospital rebasing and trying to make that a priority, and would have liked to have seen that as a priority this year. There are some problems that I have, or concerns that I have as well with the public option piece that we have there. I'm glad to see that it was pulled back to be more of a study. As Representative New Brindley pointed out, though the study piece of it lasts for 9 months, and we talked about, or she talked about the timeline for that and what that's going to require to get the actuarial firms hired and moving forward with that. And I would just remind folks that this is at the same time that the department's going to be working on unwinding from the COVID emergency. And they're going to be stretched pretty thin on a lot of these things. And so this is going to be one more piece that they're going to have to look at. One bit of, I guess, one bit of advice for the department as they're looking for those firms. Just reading through an article from Politico from December 27th of last year, and how the states have been able, who have been looking at public options, how they've been able to address their public option program and the results that they've had. The article talks about New Mexico and how their plan requires CMS to foot a majority of the bill. Talk about Colorado, where they had goals of setting 5% reduction in rates, but the best they've been able to get is 2.6%. We'll look at the state of Washington, and while they've had 3 years of open enrollment for their public option, only 7,000 people have applied for it out of the 240,000 people who would qualify for it. And also the state of Nevada, who are expecting 8,500 people to sign up for the public option when they have 115,000 who are currently enrolled in the individual market and 300,000 who are not with any kind of coverage today. And there was a conclusion in there that I think is helpful for those who are going to be putting up the actuarial contracts for the public option. Sabrina Corlett from the Health Insurance Reform Center at Georgetown University said, "I don't know that any state has hit upon the magical solution that's going to bring costs down." And that was in reference to the public option. And so as we look at this, my recommendation would be to the state of Minnesota to not hire the same people that these other states are hiring if we're going to find a new solution for this. The other piece of concern that I have today is the elimination of managed care. As Representative New Brindley said, this is really more of an implementation plan than it is just a study. And what I found interesting in reading through the language on this particular part of the bill is that the plan must make fee-for-service better than our managed care system today by achieving better outcomes and reducing the cost of health care through fee-for-service. And that's interesting to me because fee-for-service was a system that we rejected in the 1980s in order to achieve better outcomes and reduce the cost of health care. And since then, about 40 other states have moved away from fee-for-service to managed care in order to achieve better outcomes and reduce the cost of health care, but the fee-for-service moving back to that system isn't going to get us where we think that we're going to go when everyone else is moving in the other direction. So to conclude today, Madam Speaker and members, I unfortunately cannot support the bill that's in front of us. I do think that we have issues within this bill on how it will destabilize our current insurance market. I am concerned that it raises fees at a time when we have a $17 billion budget surplus. The 600 new employees that need to be hired for this, the 65% increase to the Department of Health base, and more than $1 billion in new spending at a time when we're denying basic rebasing for our hospital systems. For those reasons, I would recommend a no vote. Thank you, Madam Speaker.
The member from Olmsted, the author of the bill, Representative Liebling.
Thank you, Madam Speaker and members. Well, I usually don't talk for a long time, and I won't this afternoon. I know everyone's ready to move on, but there were a few things that I do want to respond to that I listened to today, and I do appreciate a lot of the discussion that I heard. It's really interesting. I heard from Representative New Brindley about wanting to know the reasons for abortion, and she said something about if it's economic, we want to know that. Well, gosh, we've known that for years. We've been getting those reports for years. And we've known a lot of people do say that it's for economic reasons. And here we are on the DFLers are doing something about that, not just collecting the information, but actually making it easier to have a child and bring one up. I mean, wow. I just wow. I do want to also, it's so interesting, some of the discussion. Members, I really have been listening intently to you as you've been talking. And some of what I heard has just pretty much blown me away. Representative Hudson, you talked a lot about healthcare, it's a service in relationship, talking about how it's personal. There's no public interest in your son's case. About privacy, and if you replace privacy, it becomes political. We shouldn't be interposing how we want to do things. Man, I would have thought you were pro-choice after listening to all that. My goodness, the theory behind that is exactly the one that I ascribe to. That, you know, this is a very personal issue.
Point of order,
for people.
Madam Speaker.
I'm not seeing Representative Franson. Please state your point of order.
Thank you, Madam Speaker. I rise to a point of order, Mason's 124 personalities. And I don't think she should, and motives, I don't think Representative Liebling should be casting her opinions upon Representative Hudson.
I think members, we're all at our best when we don't characterize what other people think. It happens a lot on this floor. Representative Liebling.
Thank you, Madam Speaker. And I think Representative Hudson can, anyway, he can answer, I think, for himself. Yes, he can. Anyway, I do want to, kind of respond to a point that a number of members have made about the born alive issue. First of all, there has been reporting, and if you really look at the statutes, what is reported, these people have been saying 5 were reported as having been born alive after abortion. If you look at the statute about what is reported, what is being reported, it's not actually infants that were born alive after an abortion. So you're not getting the information you think you are there. And it's very, very misleading. But what I can tell you is to respond once again to something that I keep responding to on this, and that is the idea that by taking this awful legislation out of our statute books, that we are somehow making it okay not to treat infants who are born alive. And that is not what we are doing. That is not true. That is false. It is not legal, and it will not be legal after this bill becomes law, to leave an infant that is born alive without appropriate care. That just isn't true. You don't need that born alive law to protect infants against infanticide. Infanticide is, in fact, illegal. Infanticide is illegal. It's been illegal, and it will stay illegal after this bill becomes law. There's just no question about that. So, but the idea the idea that every infant that is born alive should have intensive intervention is also false. Now, I want to go back to something that Representative Becker has said a couple of times on this floor at different times, because, and I so much appreciate his service doing as a EMS, right? He is absolutely, and he speaks from his experience, and I believe he's very, very sincere. But when the ambulance gets to your home, the obligation of that person who comes to give you that emergency care is very, very different. They are obligated to try to keep the patient alive at any cost. That's what they're there for, and get them to the hospital. But it's different when you are a physician with a patient. Now, I'm not a physician, but you know, when physicians are dealing with patients, they often, with the patient, have to make very difficult decisions. We all know there are end-of-life situations, just talking about adults, right? Where somebody doesn't want intervention. They want, you know, people make decisions about what should happen with their care. It isn't always save the person at all cost, right? And when we're talking about an infant, often, well, maybe not often, but sometimes infants are born with very severe life-threatening conditions. There was just a story, I think in the New York Times, I was trying to find it here quickly on the floor and I couldn't, but it was a story about a family where they found out at 20 weeks that the infant had a very bad anomaly, and the kidneys were not going to develop, and they didn't. And because they were in a state that did not allow abortion, and it was criminalizing for a doctor could not do an abortion when the fetus had a beating heart, so the mother had to carry this fetus to term, knowing that it was not going to live, and she did. And in the story, it has the grandfather saying, this is torture. This was torture for the family to go through this when they didn't want to. And when that infant was born, they held that infant for a short period of time while it struggled for breath because the lungs were undeveloped, and then it died, right? So that's a terrible, terrible story. These things do happen. And the problem is when that child is born, forget about stopping the abortion earlier, which is terrible in my mind in itself. That family should have been able to decide to have an abortion with nobody having to approve except the doctor and them. But putting that aside, when that infant is born, that family should be able to decide with their doctor what kind of intervention is appropriate or none. Because sometimes what the family wants to do is hold the child and spend the last few minutes with the child and not have it whisked away to have tubes and IVs and other kinds of things that are futile. And they should be allowed to make that decision. That is private. That is private. And when we put these sorts of, when we say an infant born alive must have life-saving care, we are interfering with that family that may want to make a different decision, have privacy and have peace and grieving in those few minutes. And that's why we need to take this statute off the books. It was put there, in my view, to demonize doctors, to make it seem like somebody was doing things that were unethical, that somebody was leaving infants to die. And that just isn't the case. You know, doctors do have ethical standards. I have said this before on this House floor, and because you all want to debate this same thing again, I will too. You know, doctors have ethical standards. They are not monsters. They try to do the best for their patients. And when an infant is born and it's alive, that infant is a patient. And nobody is just throwing it in a garbage can or something like that. That is just not happening. And if it did, it would be illegal. And if a hospital allowed that, that would be a big problem for that hospital, and people would probably be suing as well. So that is just a mythology that we need to throw away. And as far as, I do want to say a word about the reporting, because we did change that in the conference report. When it came off the House floor, we were simply repealing the reporting. The Senate did not want to do that, and so it is there still, but it is modified. And yes, We are taking away the questioning of the pregnant person about why they want an abortion. Because you know what? It's nobody's damn business why they want an abortion. It isn't my business. It isn't your business. It's not the public's right to know why they want an abortion. We're still going to collect information about the numbers and what gestational age. But I do not believe that the doctor should be required to sit there and ask the person a bunch of questions that have nothing to do with the medical situation they're in. And that is why that is being repealed. So, you know, there are so many wonderful things in this bill, and it is really too bad that a lot of the discussion is around this one issue. But I do want to just correct one other thing I heard early on in the debate about public versus private. I think Representative Becker was talking about this. I'm not saying, what I'm talking about is the private financing system, that we have privatized our public program. I'm not talking about private versus public hospitals. We have a range of providers in this state, and we will continue to have a range of provider organizations in this state. But I think in our public programs, we don't need to take a public program and then put a private provider in between the patient and their health care. And I heard a lot of, you know, what the managed care organizations, you know, they try to make a good case for themselves. We've been doing this for a long time. I firmly believe, and many members on this side believe, it's time to try something else, where we have county-based purchasing. We have a public program in Hennepin County, and we think that's a pretty good model. And we think that it's time to explore making a big change because it costs us a lot of money. The legislature has very little control and even very little insight into what the managed care organizations are doing with our money. And we know that most of the providers really dislike the system, and we certainly hear about that, and we know that patients often don't like it either. So I'm really pleased in this bill we are moving forward to look at other ways of doing things, because the way we're doing it right now, it just isn't working very well. So it's time to look at other things. It is time to study a lot of different options. I'm really pleased we're studying well, I don't want to say we're studying the public option in this bill. What we are doing is something we've never been able to do. Get real analysis, gather real data, and do serious analysis to see what we can do and what it will look like, so that if and when we do make a big change, which I hope we will, that we'll know that it will be really good for our state, and especially really good for the people of the state who need real health care. So with that, I ask members to please vote for the conference report. Thank you, Madam Speaker.
The member from Stearns, Representative Demuth.
Thank you, Madam Speaker. And members, we have had a lot of discussion on this bill that's in front of us, and it has been a good afternoon to hear the details of this. I will not be supporting this bill. You've heard the good things about it. You've definitely heard concerns about it. But when we're looking at new administration, new IT spending of over $30 million, hundreds of new FTEs, over 600 new FTEs, there is definite concern with that. We know that the insurance provisions contained in this bill are going to destroy the individual market that has been so fought for to stabilize over the last few years. And we definitely know that new mandates drive up costs for all Minnesotans. We've heard talk on some of the abortion provisions within this bill, and I do have grave concerns on a number of those. There was an elimination of the positive alternatives funding, and that is not pro-choice. That is limiting. We know that there is a double down on the extreme provisions, as we have heard, and I have to say that the contrast with Representative Baker, when he goes on an emergency run, or Representative Hewitt, you know, with the background in emergency, paramedics that are going to help those most in need. They are there to save lives. In no way in the conversation today has anyone tried to demonize our medical professionals. But in the case of an abortion that has failed, with a potentially viable baby laying there, we know that that baby cannot advocate for itself. We're not trying to criminalize anything. We're saying that life child that is alive in that moment should be given care. And that seems like the most basic of human rights, to be given that care. We know by eliminating the reporting, as you've heard, the reporting has helped. It's even helped develop an entire new department that's being proposed. But if we eliminate the reporting, we have no idea. And for a doctor to ask just a couple of questions to a woman that is accessing abortion care is not a problem, and it should not be eliminated. We also heard from the majority, from Representative Liebling, saying that possibly Representative Hudson was almost pro-choice. Madam Speaker, would Representative Hudson yield for a question?
He will yield. Representative Demuth.
Thank you, Madam Speaker. Representative Hudson, I heard on this House floor maybe a little bit of confusion based on your earlier comments when you were testifying. Could you briefly just clarify for the body if you are pro-choice, and if so, why not?
Representative Hudson.
Thank you, Madam Speaker. Thank you, Leader Demuth. I'm pro-liberty, and liberty is the ability to make choices without the initiation of force from others. And the condition that you need in order to be able to do that, the prerequisite for it, is being alive. And so, this idea that choice is something that's exercised by the decision to end the life of another person, a person who you have responsibility for and custody of, I find abhorrent. Amongst the choices that are available to us, killing people because we find them personally inconvenient is not on the list.
Representative Demuth.
Thank you, Madam Speaker, and thank you, Representative Hudson. I appreciate you clarifying so the entire body knows where you stand. I appreciate that. Some of the other things in the children and families portion of this bill, and I am an advocate for childcare and have continued to work on that. But one thing that I want to point out is we know, as Chair Pinto has alluded to, the conversation over the last few years with potential and proven fraud within CCAP. When we had said a number of years ago that there was $100 million in CCAP fraud, that was actually pushed off, saying that could never happen. That's too extreme. There's no way there could ever be $100 million in CCAP fraud. Well, I think that has been debunked this year when there has been found to be over $250 million of fraud in feeding our future. And every time there is even a dollar that is lost to fraud, that takes away the needed funding from children, from parents, and from child care providers. And we have to be serious on fraud and preventing it, holding those accountable and preventing it. We know that we have lost over 700 family child care providers since just July 1st of 2021. But in this bill, and what has been heard on this floor, there is almost an attack against family child care providers and making it harder for them to continue to do the work that we need. The Department of Children, Youth, and Families has been talked about, and that will become law. We know it can be signed into law. But anytime that you combine the work out of different departments, common sense would say that there should be, in that consolidation, a reduction. We should not be growing government in one place to do the work that has been done by multiple other departments. That should be a reduction in government. Unfortunately, with this, we are looking at over 112 new FTEs
in this department alone in the year 2025. So members, with the things that you have heard from our side of the aisle, the concerns that have been raised, I will be a no vote, and I would encourage a no vote on this bill.
The member from Hennepin, Representative Long.
Thank you, Madam Speaker. With the budgets we passed this year, we have made historic progress in solving problems that have long been neglected and in helping Minnesotans afford their lives. Our final budget bill tonight is no exception. Healthcare costs are skyrocketing and Minnesotans are suffering as a result. Most Minnesotans on the individual market buy bronze plans with an average deductible of $7,000. That is catastrophic coverage only and means Minnesotans are delaying or not seeking care they need with often tragic results. The Minnesota Care public option included in this bill is a historic step forward for the thousands of Minnesotans who are uninsured and the thousands more with coverage that they can't afford to use. This is not just a study, as some on the other side have said. This is an actuarial analysis that authorizes the beginning steps of implementation for this important policy. We are also saying in this bill that all people deserve access to health insurance. And I want to thank Representative Perez-Vega for her strong comments on the floor. Thousands of essential workers in Minnesota, including immigrants and mixed immigration status families, currently only have access to emergency care, and that is not right. I've seen some incredibly offensive tweets from members across the aisle on this topic, but I won't repeat those here. But let's be clear. Providing health care to those who live in our state is the humane thing to do, it's the moral thing to do, and it is also the smart thing to do. It benefits no one to have our hospitals paying for uncompensated care. And it makes us less healthy as a state if we are not caring for our neighbors. Last I checked, viruses don't care about immigration status. The coverage for undocumented Minnesotans in this bill is supported by doctors, hospitals, nurses, health insurers, faith leaders, and more. Denying health care is un-Minnesotan, period. Members, this is our last budget bill. We also have a great capital investment bill coming up soon. We'll be ending on time tonight and have done our work to fund our state budget. And with this bill, we're also ending on target, living up to our values that every Minnesotan, no matter your medical condition, zip code, income, or immigration status, deserves affordable, high-quality health care. Vote green.
The clerk will take the roll on the bill. The clerk will close the roll. There being 69 ayes and 64 nays, the bill is passed as amended by conference and its title agreed to. Messages from the Senate.
Message from the Senate. Madam Speaker, I hereby announce the passage by the Senate of the following House file, herewith returned as amended by the Senate, in which amendments to concurrence of the House is respectfully requested. House File Number 670, an act relating to capital investments. The message is signed Thomas S. Bodden, Secretary of the Senate. Lee F. moves that the House concur in the Senate amendments to House File Number 670 and that the bill be repassed as amended by the Senate.
Members, I know it's loud outside, but if we can have it a little bit quieter in here. Representative Lee, if you could explain the Senate amendments.
Thank you, Madam Speaker and members. House File 670, this is a motion to concur. This is the general fund cash infrastructure bill that all caucuses have agreed on. And just for all of you, the spending in the general fund portion of the capital investment bill is roughly $1,034 million. This is just a little bit more. As you recall, back in the March conversation that we have on the general fund cash appropriation bill, that was a total of $393 million. And so I just wanted to note that as we have this conversation. Thank you.
Any discussion on the motion to concur in the Senate amendments? Seeing none, all those in favor, please say aye. Aye. Those opposed, please say no. The motion prevails. The clerk will give the bill its third reading as amended by the Senate.
Third reading, House File Number 670, as amended by the Senate.
Third reading as amended by the Senate. Discussion to the bill. Any discussion to the bill? Representative Igo.
Thank you, Madam Speaker. I wanted to speak to one thing that's in House File 670 here today that's very important to District 7A in northern Minnesota. That is the Canisteo Rising Pit Waters. It's been a project that we've been working on for over 2 decades. And today, with the passing of this bill, it's going to mean that the people of Itasca County, the communities of Coleraine, Taconite, and Bovey are going to get the fix they need to know that their homes aren't going to be destroyed and their communities will no longer be at risk. So I want to thank everyone from the community of Itasca and the surrounding area, everyone that's been working on this for over 20 years. Today, we're finally going to get it done. Thank you, Madam Speaker.
Further discussion. The member from Meeker, Representative Erdahl.
Thank you, Madam Speaker and members. Going with the bill to follow, and this one often, well, at least in the tax bill, they come up with song titles. I've come up with, it's been a long and winding road for a bill that started over 2 years ago. Now, this bill has more cash in it, I'm sure, than any other bill in Minnesota history. Normally, our bills are heavily on GO and a very small amount of cash. This one has one heck of a lot of cash, and frankly, our priorities are different. Were we in control, the bill that we would write dealing with cash would have different priorities. But I recognize the reality of where we are, and that, again, the majority's priorities are different from the minorities, and that is what we face. And I urge everyone to vote.
The member from St. Louis, Representative Listagard.
Thank you, Madam Speaker. I just wanted to take this time to thank Chair Fu. He did an outstanding job bringing people together, looking at the whole state of Minnesota. And I can tell you that my region, the district that I represent, is going to do extremely well. And people's lives are going to be enhanced by the investment that you put forward in this bill. The whole state of Minnesota is going to benefit by this bill, and I couldn't be more proud. I joked with Representative Schultz over there that we voted on the train yesterday, and just because it passed, we didn't have it built, and he said he was going to grab his truck and help me haul all my money up north.
Further discussion to the bill. The member from Chisago, Representative New Brindley.
Thank you, Madam Speaker, and thank you, Representative Erdahl, for pointing out that we probably have different priorities than the majority. And you know, it's unfortunate when the bloated bonding bills are loaded up with projects that really should be covered by local municipalities and local taxpayers. I am 100% for HEAPR. We need to take care of the buildings that we as a state own. We should take care of infrastructure, our roads, our bridges, our wastewater. Everyone in this state should have clean water. I think we put out unanimous votes this session on cleaning up lead in our water and making sure that that was a priority. But when we see things in these bills like fire stations, community centers, ice arenas, swimming pool, convention center, I'm I'm just looking through for some of the most obvious things. You know, I mean, there's several swimming pools in here. You know, my community, we struggle to pave our roads. If only we had money for a swimming pool. But instead of my community paying for their own swimming pool, now my communities are going to pay for your swimming pools through this bonding. It's kind of gross. It's kind of gross that you are saying that the residents of North Branch should pay for these things. And I just want to call out a couple of particularly egregious items in here, and it's for one reason. There's an appropriation in here, there's cash in here for Giants Ridge, and there's cash in here for Spirit Mountain. And I want to tell you what the problem is, particularly with these two provisions. We are putting state dollars, in fact, the owners of Wild Mountain, the owners of Afton Alps, the owners of Buck Hill, the owners of Mount Cato, the owners of all of the ski resorts across the state of Minnesota are paying taxes to subsidize their competition. We've got $25 million in this bill to subsidize businesses owned by municipalities that are in direct competition with private business owners. It's no wonder. I mean, it's just yet another example of how the Democrat caucus has zero cares to give for business in the state of Minnesota. In fact, we are going to directly fund your competition. We're not just going to tax you to death. We're not just going to mandate you to death. Now we're actually going to fund your competition. It's bonkers.
Further discussion? Seeing none, the author of the bill, Representative Lee.
Thank you, Madam Speaker and members. Members, oftentimes when we go on tours across the state to visit projects that are asking for our consideration for state investment, we get to see projects from years past and often see how communities benefit from the investment that we have made. And so in this bill, with the focus that we have had, Representative Erdahl mentioned this. I think that for us on this side of the aisle over here, we understand that oftentimes there are issues in our communities that are not being served by public or private interests, and so that's why we have nonprofits. And if you look at what we have in the provisions for some of these community organizations, they work on, for example, the project in my area, providing shelter for homeless youth. And then we also have projects in there that, similar to some of the work that we did earlier this session, looked at emergency shelters, help with our food insecurity in the state of Minnesota, every meal. Representative Becker-Finn, Chair Becker-Finn is carrying that. And then also, community wealth building. We know that oftentimes community members, they need culturally appropriate health and well-beings and practices to make sure that they actually can thrive in their community. And so that's the type of investment that we are making in our communities here with this cash appropriation bills. And I'm really excited that we have this before us, and I'll save most of my remarks for the GEO infrastructure bill. Thank you, Madam Speaker.
The clerk will take the roll on the bill. The clerk will close the roll. There being 78 ayes and 43 nays, the bill is repassed as amended by the Senate and its title agreed to. Message from the Senate.
Message from the Senate, Madam Speaker. I hereby announce the passage by the Senate of the following House file, herewith returned as amended by the Senate, in which amendments to concurrence of the House is respectfully requested. House File Number 669, an act relating to capital investment. The message is signed Thomas S. Bodden, Secretary of the Senate. Lee F. moves that the House concur in the Senate amendments to House File Number 669 and that the bill be repassed as amended by the Senate.
Representative Lee.
Thank you, Madam Speaker and members. That is my motion. House File 669 is the GEO infrastructure bill.
Thank God.
I really appreciate the partnerships that we have with the minority caucus here in the House. Back in March when we sent this bill with bipartisan support over to the Senate. Before we get started, I just want to say thank you to the members of my committee and thank you to the Speaker and the minority leader for appointing the members that we have on the committee who are some of the most well-thought committee members that I would say that we have in the body, and really evaluating these projects and see how they impact every Minnesotan. To Lead Erdahl, thank you for your partnership and getting this bill this far. This is our second time, first in March and this time, and so hopefully we could get it through this time around. And then also to our nonpartisan fiscal staff. First off, I just want to say thank you to Chelsea Griffin, Andy Lee, and Ken Savory from House Research and House Fiscal. Like I mentioned before, I think that we have some of the hardest workers. They went through this back with me in March, and all of us back in March, and now we're doing it again. And so I just want to say thank you to all three of them. Next, I want to say thank you to Jeff Case, too. Oftentimes there's circumstances in our life that gets into the way of our work, and you have to prioritize between work or having a personal life balance. And just want to acknowledge that Jeff from the Revisor's Office went through some hardship, but he remains dedicated to working with us, and that's why we got to this point. Next, I want to say thank you to Chelsea Axelson from the House GOP, Jen Nelson from House DFL for both of their work in helping us and our members understand what's going through committees and as we start preparing for our tours. I also want to say thank you to Abdul Aziz Mohammed, who is my committee legislative assistant, who has made it possible for us to not only consider projects in the previous 2 years, but for this year too. Most importantly, just want to say thank you to Ms. Jenny Nash, our committee administrator, who oftentimes, it doesn't get the thanks that, she deserves from all of us. So with that, Madam Speaker and members, these are two great bills. We have House File 670 already, and now with 669 before us, I urge your support for the motion to concur. Thank you.
Further discussion on the motion to concur in the Senate amendments. Seeing none, all those in favor of the motion to concur, please say aye. Aye. Those opposed, please say no. The motion prevails. The clerk will give the bill its third reading as amended by the Senate.
Third reading, House File Number 669, as amended by the Senate.
Third reading as amended by the Senate. Discussion. The member from St. Louis, Representative Scraba.
Thank you, Madam Speaker. I want to thank Chair Lee for a great opportunity to learn how the bonding process works, everything about it. He runs a really tight ship. I look forward this summer, as a member of the Capital Investments, I look forward this summer to going with all our members and learning about the projects. I came on board, and a lot of these projects were already in the go, so I just want to support what we're doing, and I appreciate the opportunity. Thank you, Madam Speaker.
Discussion to the bill. The member from Dakota, Representative Garofalo.
Madam Speaker and members, oinky, oinky, piggy, piggy. Boy, do some politicians like to spend other people's money. No shortage of that in this chamber today, is there? But let's put our thinking caps on for a second and understand, as we congratulate and pat each other on the back for what is an unprecedented and explosive amount of government spending in our state and now record borrowing, what does this mean for the future of Minnesota? And what we are seeing right now in the state of Minnesota is an unprecedented migration of people, wealth, and investment out of our state to other communities. Now, I recognize that some of them on the other side of the aisle, you don't want to know the truth, you don't want to believe the truth. Tough cookies. The math is the math. The most recent year available, the state of Wisconsin, our peer, roughly the same size, roughly the same demographics, lost $61 million in adjusted gross income. The state of Minnesota that same year lost over $1.5 billion of our adjusted gross income. $1.5 billion. There is no longer any doubt that this trend is accelerating of money, investment, and people leaving our state. And so the bill we have before us today is another nail in the coffin for economic livelihood in the state of Minnesota. More borrowing, more spending on government that is crowding out a private sector that already doesn't have enough workers. And it is very clear the economic damage that is being done and the pathway we're on. Now, the good news is our state is not as bad as Illinois or New York. That's the good news. Here's the bad news. The state of Minnesota is not as bad as the states of New York and Illinois yet. The policies we've been enacting this year none of them is original. They've all been done, from expanding health care to people who are here illegally, more employer mandates onto our businesses. These have been implemented in other states, and they have failed. And the wealth migration you are seeing in those states is the direction Minnesota is on. So today, as we pat each other on the back and congratulate ourselves for excessive spending and yet even more borrowing, know this one message: the spenders are not done. They are not done, and I will guarantee you that when this session adjourns, the demands for even more spending and even more borrowing will be inundating legislators to meet the unmet needs of the state of Minnesota. Madam Speaker, remember, the lesson of the session is very clear. Never, never trust the Democrats with your wallet. Vote no.
The member from Isanti, Representative Doubt.
Thank you, Madam Speaker and members. I couldn't agree more with Representative Garofalo. I've stood up a few times on the House floor this session in what I thought would be a sobering wake-up call. This bonding package is the equivalent of $2.6 billion. That's on top of the, $1 billion of that, or $1.1 billion of that is cash. The rest of that is borrowing. So we're borrowing, $1.5 billion when we have a surplus of $17.5 billion, and on top of that, tax increases of around $9.5 billion. Just to put into perspective how much those tax increases will cost the average taxpayer in the state of Minnesota, I did the math. The average taxpayer in the state of Minnesota will pay the equivalent of $3,500 per person in new taxes because of what the Democrats are doing. Just in the new taxes. Okay, that doesn't count the surplus. And what did they do for you? They broke their promise. They didn't send you $2,000 back like they said they were going to do when they were asking you to vote for them. They're sending $260 back. So they're putting $260 in this pocket and taking $3,500 out of this pocket. Nobody's going to be fooled, okay? The surplus equates to, you could have sent a check back to every taxpayer in the state of Minnesota the equivalent of $6,200. $6,200. So add the $6,200 and the $3,500, and that's almost $10,000 of brand new spending for every taxpayer in the state. And on top of that, you're going to borrow $1.5 billion new dollars in this bonding bill to spend on stuff we shouldn't be bonding for. And that's the real reason that I rose. I wish Mary Liz Holberg was still in the chamber, because you'd get a scolding right now for the stuff you've got in this bill. And what I'm talking about, and this, very seriously, I'm not trying to scold you, really consider what you're doing. We got to change our policy. You got a whole bunch of stuff that should be paid for with local property tax levy money in this bill. I'm talking about police stations, I'm talking about fire stations, I'm talking about city halls, all kinds of local parks. I understand that everybody wants to come to the Capitol and they want to show that they brought home the money, okay? Well, my community of Zimmerman, Minnesota, just in the last couple of years, finished a brand new fire station. I think Zimmerman's about 7,000 residents. They built a $5.4 million fire station. And you know what? Nobody in your communities has to pay for that. Only the people in my community are paying for that. And that's the way fire stations are funded in this state. But now we've got a dozen or more fire stations, probably a dozen police stations. And I've noticed that we don't call them police stations in the bill because the lobbyists have all gotten smart enough that they're all regional public safety centers now. You know what a regional public safety center is? A police station. And now my taxpayers in my district are going to pay for the police station and the fire station in your district. So not only are you raising taxes by $3,500 on average per Minnesota taxpayer, but you expect taxpayers in my district who are paying for our brand new fire station by themselves to now pay for your fire station and your police station. That is wrong. We should not be doing that, and I wish Mary Liz Holberg was here because she'd give you a real scolding. This would be mild, what I'm doing to you. But members, we have to change that in the future because what you're doing, and I'm going to say the quiet part out loud, what you're doing is you're training the lobbyists out here. They're the ones who are really going to benefit from this because they're going to go to all the cities in the state and they're going to say, and the counties, and they're going to say, hey, if you hire me and put me on a contract for $40,000 or $60,000 a year on retainer, I will go to the Capitol and I'll see if I can get you a police station and a fire station. And now you're all going to get bombarded with a lobbyist from every city across the state asking for something that we at the state level should not be paying for. Now, it's fine if you want to change the policy, but I expect every one of those cities and counties that are getting fire stations and police stations in this bill, we don't fund jails, we don't fund police stations, we don't fund fire stations. Those are local property tax levy issues, okay? I expect now that when I look at the property tax levy for those cities that have fire stations and police stations in this bill, that I'm going to see a reduction in property taxes. That since your property taxpayers aren't paying for that now, and you've shifted it on to my property taxes and my taxpayers, that your property taxes are going to go down now because the taxpayers statewide are paying for something that your local property taxpayers should be paying for. And if I read off the cities that are getting these benefits, you'd be shocked. Because believe me, those cities can afford to pay for their own police station, their own fire station. So there needs to be some level of principle here in our, in our bonding policy. So, and this is serious. I'm not just, yes, I am scolding you, but I'm not just trying to scold you. Because if this is the policy now, then every city and every county is going to want the state to pay for their police station, their fire station, instead of their local property taxpayers. And that's the way we've always paid for those. And the numbers in the bill are kind of shocking when you look at $10 and $15 million for one police station or one fire station. That's kind of shocking. So, members, this is not something we should be doing. We don't need to be borrowing this much money on top of the gluttonous level of spending and taxing that you've already done to Minnesotans. This is like the nail in the coffin for Minnesotans. And I'm afraid exactly what Representative Garofalo said is going to be true, that all you're going to do is drive more Minnesotans and their taxes out of the state. And I've said for years that there's not somebody at the state line with a clicker, that when those taxpayers leave the state, that we then reduce the levy or reduce the spending here in the state to match the loss of that tax revenue. Those people are gone, and then what you have to do is you have to increase taxes more and spread it out over the people that are left here. So you shouldn't be chasing people out of the state that have wealth. You should put policies in place that encourage people that have wealth to stay here and to move here. And you are going exactly the wrong direction. And the data does not lie. As much as you don't want to believe that it's true, the data does not lie. Your policies are driving wealth out of the state. And they're taking their tax dollars with them, and they're not paying state taxes here in Minnesota anymore. And if that's what you want, what that means is you're going to have to continue, just like you're doing now, to increase taxes on all the Minnesotans that are left here, including the low-income ones, which is what you've done a great job of this session, really taxing the low-income Minnesotans, the ones who can't afford it. So, members, this should be a sobering moment for you. I keep thinking that you're just going to, like, we're going to wake up from a drunken hangover and you're all going to realize what you've done to the state. But I haven't seen it yet. And unfortunately, today is the last day. So this is your last moment where you actually can do the right thing and vote this bill down. So I'd encourage, I do appreciate this is the first time I've ever had a project in a bonding bill. I do have a little highway project in the bonding bill. I'm still going to vote against the bill because it has so much other crap in it. But I do appreciate you putting my project in the bill because I've never had one. Been here, I'm in my 13th year. I've never had a project in a bonding bill, so I do appreciate that. But members, unfortunately, there's just too much other stuff in this bill, the one we just voted on, and it's not the time that we should be borrowing this kind of money and shouldering the taxpayers with this kind of debt. So I'd encourage you to vote no.
Discussion to the bill. The member from, I can't believe I can't see it from here, Ramsey, Representative Lilly.
Thank you, Madam Speaker and members. It's really such an honor to be on the Capital Investment Committee. Honestly, we get to see the whole state, and it's really an amazing state that we live in. And this bill captures it. And we go to every one of your districts, everyone, and it's kind of fun to see. And some of the people you'd be surprised that might speak against things, even asking for money and. But it's, I'm not going to go there. Otherwise, Engen might call me out or something. But, and I've been lucky enough to be under GOP leadership and ours. And I'm going to say the same thing. We just really have an amazing state. And this bill really captures it. The speaker since day one of this, before the session said, we're going to pass a bonding bill. And here we are today. And I just think it's really the right thing. And if you do talk to previous chairs and people that have served on the committee, it's so important to pass these bills every year, every biennium, and to get these projects moving. And this takes care of things. This bill things that haven't been done, in this, so it's picking up the previous work that didn't pass. And quite honestly, some of it's really not that exciting. It's roofs on our college campuses. Not really exciting. It's not all this fancy ribbon cutting stuff you might think. The DNR has tons and tons of buildings. And this bill captures that. Both of these bills capture that and takes care of it. I'm just going to quickly speak about, it's kind of leaning over to the previous cash bill. I'm one of those that's really excited about the things that are picked up in this bill. And there's a lot of new things that really traditionally haven't got money. Keystone, right up the road here on Rice Street, a food shelf project. Appetite for Change in Minneapolis, doing amazing work, connecting people with food and other projects. 30,000 feet. If you went into 30,000 feet and seen the work that they do with kids of our communities, it's amazing. The Somali Museum, they came to Legacy, and we've heard presentations from them. Amazing work. V3, we heard about swimming lessons and stuff, or swimming being a problem. Minnesota, there's a lot of kids that drowned in Minnesota. I mean, it's really sad to think that we have all these lakes and people can't swim. This bill leans into that. And maybe there's going to be at this V3 in Minneapolis, there might be a SUNY Lee. there might be a Jesse Diggins there that rises up. How amazing would that be? Plus learning how to swim. The Sana Foundation, over here, Tony Sana. If you ever have a chance to meet this guy, you'd give him all the money of our budget, really, because he just does amazing work. This is, so a lot of these are really great projects. You know, there's always something in every bill, I suppose, you can look at and you don't want. I really want to compliment Chair Lee. He's just really, I think, what is it, 500, in the last bit, it's been 500 hearings, you know, that we are in this. This bill captures 500. It's not like a made-up number. It's like, there was like amazing amount of your community that came in. That's real people that came in and met with us. And so hats off to Chair Lee, and obviously he mentioned our team. We're just an incredible team, but really, you know, the Speaker, I really think this is so important for Minnesota, and I know that, having talked to many of you, how important it is to pass these bills every year, and we're doing it. We're doing it, and I think we all should really be proud. We have an amazing state, and I think it's important that we vote green today and really care about our state, and this is truly a way you can do that.
Discussion. The member from Chisago, Representative New Brindley.
Thank you, Madam Speaker. So as I look through, as I look through the GO, the bonding portion of this bill, and of course that means borrowing. We're borrowing money, right? That's what bonding means here at the Capitol. It means we borrow money instead of paying cash. And the good news is the bonding portion of this bill is much better than the cash bills that other people just passed out of this chamber. But I want to talk for just a moment. You've heard me say it before, and you're going to hear me say it at least one more time. $18 billion budget surplus, $10 billion in new taxes. So the Democrats had almost $30 billion to work with. $30 billion of additional spending, and on top of that, they couldn't find within that $30 billion money for critical things like maintaining the schools that our state owns. Those assets are higher, we call it HEAPR, the higher ed asset preservation. In $30 billion, you could not find 181 million for higher education to preserve those assets. $30 billion, you couldn't find that. And instead, you know what we're borrowing for? You know what? We're borrowing for community tree planting grants. We are going to borrow money. We couldn't find $8 million out of $30 billion. So instead, we're going to borrow that money and have the taxpayers on the hook for that for years to come. There's some good stuff. A lot of water projects, actually, and road projects in here. That's good stuff. But with $30 billion to spend, the Democrats decided that rather than paying for these things that everyone in this chamber agrees are critical, I think this is the one thing we all agree on. We should be making sure that communities have safe and effective wastewater treatment. We should make sure that communities have what they need to maintain their road infrastructure and their bridge infrastructure. Obviously, as Minnesotans, we are particularly sensitive to bridge infrastructure in this state, rightfully so. Every single person in this chamber agrees that these are core functions of government. And yet, as core functions of government, the Democrats did not think that they could find $1.5 billion to pay for those core functions of government. Out of $30 billion, they could not find $1.5 billion to pay for the most the most obvious core functions of government. You know, again, my community can ultimately choose to pay for its own swimming pool, to pay for its own ice arena, to pay for its own community center. My community can choose to pay for that. But there are communities across the state who cannot just choose to pay for wastewater. They don't have the tax base. They literally cannot come up with the money to do that without completely breaking the backs of their residents. It is a core function of government. And yet, in a year with, again, it's not just $18 billion, it's almost $30 billion that the Democrats have created to work with this year. They're going to say rather than taking care of these most core functions of government, instead, they're going to make Minnesotans pay for this for years to come. We are going to incur more debt that we have to pay debt service on every year. And I mean, of course, when we say you have to pay debt service, it means you have to pay your bills, right? You have to pay your principal and interest on your debt service. We're going to pay for this for years to come because the Democrats could not say, you know what, it's just the right thing to do to pay for wastewater. It's just the right thing to do. But nope, we're going to borrow money. So this almost $30 billion surplus, now we need to add $1.5 billion on top of that. About $31.5 billion. That's what the Democrats are spending this session. I've said this in years past. It is never enough. There will never be enough money. In fact, I think it was a Democrat senator who said that the Democrats here have an insatiable appetite for taxing, an insatiable appetite for more money. And boy, if that has not become clear this session, I don't know that it ever will. $30 billion, and yet we're going to borrow money to pay for the most core functions of government because the Democrats could not bring it themselves to prioritize those things. The Democrats could not say that, you know what, the first things we should check off our list are those things that government should be responsible for. Instead, we're going to pay for every wish list under the sun in every bill scattered across this session, and then we'll just borrow more money for the things that we actually should have prioritized to begin with. It's pretty wild. It's pretty wild with all the money that has been spent that you chose to save these core functions of government for the very last thing. The very last thing. So there's no money left. Now we got to borrow money to pay for these things that we actually should be doing. These things that should have been paid for first. Our current obligations. This is the Democrat way. It's pretty wild. It's a wonder anyone manages a budget at all. I think it's clear how I will be voting on this bill.
The member from Morrison, Representative Krisha.
Thank you, Madam Speaker, and thank you, members. First of all, this is a place that's a contest of ideas. This is a place where we door knock and we talk to folks to get here. And one of the things that I'm reminded of is everybody that comes to visit the Capitol when I'm here tries to sit in this seat because of the placard in the front and the pride that they have for the district they have. And when I go back and I walk through the events, I go to the schools or I go to the churches, I hear the stories of the people that I represent. I'm not going to come in here and tell one way or the other on how to vote or all of that. I'm just going to tell my perspective. A couple of years ago, Senator Tom Bach who it was very interesting on how his pathways went. But I happened to be up at his fundraiser, I think it was a year and a half, 2 years ago. And lots of people were there. And one of the things that Tom said to the crowd was he had called his friend David Tomasoni on the way back from the session and said, wow, we got a lot done for our district. And I thought about that. And here's a person who didn't really, at the end of his career, didn't pick which side he was on. He was still for his district. And let me tell you why what's in front of me is important and why I will continue to vote for those. Because project number one for me has been the Minnesota Military Museum that started way, way, way back when I've been representing the area and knowing Camp Ripley, knowing the stories, and knowing that when there's deployments, I am out there in the bleachers watching the young men and women and their families saying goodbye or welcoming them back. The Military Museum for me is sitting on the tractor with my grandfather, who was a World War II veteran, who could not share stories with his family even in his latter years because they were too painful. But thank God my grandmother saved all of the letters and everything she had so that those could be donated and those stories we could find out later, that he sat on top of the hill during the Battle of the Bulge taking mirrors off of his artillery trucks as the Panzer tanks were turning their fire on them. The stories of how he went and saved friends of his that were classmates from Kearney, Nebraska, went behind the lines against the orders of his superiors to bring them back in dark areas of France. In Nebraska, we don't have trees. We have flat lines. These young men were in foreign areas, had no idea what they were doing, and they were looking out for each other. Those stories were preserved. And when you hear those stories and you go to the Military Museum and you see the artifacts and you see what's there, what you really see is the stories that are coming forward. And a couple years ago, we were informed that the Military Museum had to be moved out of the encampment of Little Falls because it's on the flight line of the C-130s. And literally, when there's 15 people there, when a bus full of students are there and the C-130s start coming in, you have to get everybody out. And so we committed to moving that outside the encampment so that we could make this more accessible. And I will tell you this, through the work of the friends that and the relationships here, this will be one of the biggest nationwide military museums and assets in the country. That's phenomenal for us. So thank you for all those that helped me with that. Project number two. There's a lake, Lake Chaminade, that I've been working with for a long time. They're flooding, folks. There's no outlet for the water. They can't figure out why. And homes are literally being eaten up. This has been happening for 20 years. And they can't get FEMA help because every time FEMA calls them and they talk to FEMA and FEMA says, well, what's the date this started? Like a hurricane or a tornado, we have to be able to have a date. And they say, I don't have a date. It's just been happening. So FEMA and the insurance folks never fund them because this is ongoing. We now have a flood mitigation project in there, and many, many of the people that come up and use the assets in my district will be able to use the properties. And more importantly, those grandkids that now own those generational cabins as it's getting passed on will be able to use properties again that have been buried. There are places where the mail trucks can't even get to them. All the things we take for advantage, like if I need something for Amazon, that can't happen because they have properties that they can't get to. So thank you for that. Project number 3 that I was very happy to see come across is in Aiken County and working with Representative Igo. That's a huge thing, Health and Human Services for the counties of Aiken. If you've been up to the Aiken County, and I'm happy to represent parts of that now, it's they're caught between so many different industries. They have tourism, they have agriculture, they have mining, they have woods, they have, and all of these things, so they really can't get a foothold in any economic industry. They really can't go anywhere, but yet people are all there during the summer, and they're there for the ice fishing and all that, but it's just hard. It's a transient county, so this is a huge thing. And the last thing that I'm going to call out to is there's a little tiny museum. It's the Weyerhaeuser Museum. You've probably heard the name Weyerhaeuser. If you go to one of the homes on Summit, and we go there for a fundraiser. You can read all about the login and the Weyerhaeuser. Well, it has roots back to Morrison County. And there is a group in Morrison County of folks that have been working on museum projects, and they have this little Morrison County museum. And the problem is they're right on the banks of the mighty Mississippi. I can go through all the marketing slogans. I can tell you about the wonderful times up and down with your pontoon. The problem is they're on the bank of the Mississippi and it's sliding into the river. And they're on a shoestring budget. They have no money. I mean, literally, you know, I try to stuff money in their donation box whenever I go there to visit and do the projects, but it's not enough to stop the museum from sliding into the river. And I have one person in particular who I've become very close to, and she's been working very hard. This woman her perseverance is unbelievable. She's written everybody, including the Pope, for funding. And couldn't get anything from Congress, couldn't get anything in grants, couldn't get anything from all these things. And I told her, I said, I'm going to try to find a spot for this. And lo and behold, it was able to happen. And it happened at a dollar amount that they can get the whole project done. They were worried. They're like, well, can we just get the planning done? Can we just get the architectural? We are literally taking the stress off of all these people who have been so worried about their project and preserving that asset. So there's lots of reasons to talk about this bill. But I can tell you this. Everybody that comes and looks at the placard in the front of this desk knows that I'm happy enough just to keep this seat warm, but at the end of the day, this is their seat. And my only job is to listen to those and to do the very, very best I can for the people that have sent me here. Because at some point I won't be here, but their projects will be. And so members, I'll be voting green.
The member from Anoka, Representative West.
Thank you, Madam Speaker. In this bill, which I voted for the bonding bill on its way out when it had nothing. And then it came back, thank you, Chair Lee, came back with $25 million for Highway 65. This is the worst road in the state. It is a complete disaster that averages of one accident a day. This $25 million combined with the $9 million in the cash bill and the $68 million in the transportation bill means we're going to have real construction on Highway 65, which we have been dying for years of in Blaine. And it's a shame that it got lumped in with all these tax increases in the transportation bill, but in this bill, it's just with the regular general obligation bill, with important infrastructure for our state. We need to invest in these projects. People don't have clean drinking water. Some people have to drink bottled water. It is a catastrophic event that if you were any of the people affected by some of these projects, you would be flabbergasted of why the legislature hasn't acted on it. So I'm incredibly excited to vote for this bill. Highway 65 is going to finally get funding for an entire section of the road. And there's still more to do on that, but this is really important because with an accident a day, people get hurt all the time on Highway 65. It divides the city where people cannot even cross the road. We have a Walmart on both sides of 65. We have a Target on both sides of 65. We have Lowe's and a Home Depot on both sides of 65 because it's such a barrier in Blaine. Those issues will finally be addressed thanks to this funding and more. It is such a good thing to see us investing in this state because we've seen a $20 billion budget surplus be just blown through faster than you could possibly imagine. And then all these tax increases. But the one kernel that my community can take away, Highway 65, 105th, 99th, and 109th, and the West Side Frontage Road are now going to be funded. And this is something the community has been waiting for a long time. So thank you, Chair Lee. Thank you, Representative Erdahl. You've been a great help to my city, and I am excited to vote for this bill.
Further discussion other than the wind-up speakers of Erdahl, Ryer, and Lee. The member from St. Louis, Representative Zalesnikar.
Thank you, Madam Speaker, and thank you, members. I know it's the last day of session, but I just want to say that the things I like in this are the safe routes to schools. I heard that when I went to Proctor from the kids often when I did reading at the schools. The ATV trails for St. Louis County in the north, that is a big connection for all the communities to get to the restaurants, the bars, wherever they're going, and it brings in revenue. The greater Minnesota housing infrastructure, and to the mayor who recently passed away in Rice Lake, he wanted this water and sewer extension so bad for the city, which Rice Lake is a city, and he got it. So I know he's listening for above, and I just want to say he fought very hard for this. It was in here before I came, and I carried it along the way for him and for the people of Rice Lake. But also the child care money that's in for greater Minnesota facilities. I think child care is a big issue in greater Minnesota, like I've said many times. And there's money for the behavioral health for Duluth, which I think is really, really important, the behavioral health items. The townships have money, various items there. And there is an ice arena that I live in, Hermantown, that's going to get money. And for those of you that are tired of seeing them in Class A, maybe now that they have 2 sheets of ice on a positive note, maybe they'll someday go Class AA. So I'm voting green. Thank you.
The member from Washington, Representative Weens.
Thank you, Madam Speaker. Thank you, Chair Lee. Thank you, Lead Erdahl. I'll be voting green on this. I really appreciate the bipartisan effort in order to help my community. So we've got Highway 36, which runs through lovely communities all the way from Stillwater into the metro here. And we've had a lot of traffic there since the new $250 million bridge was put in across the St. Croix. And it's imperative for me, as I listen to Lead Creshaw, is this whole thing about connecting our communities, because there's nothing more important than being able to have safe travel, effective travel, that we can work together on those things. And so in that way, thank you very much. I'll be voting green, Madam Speaker.
Further discussion. The wind-up speakers. The member from Meeker, Representative Erdahl.
Thank you, Madam Speaker and members. I would like to begin by thanking some folks too. As I indicated before, I've been working on this for quite a while, over a couple of years. And so I want to thank Senator Tom Bach, who began this with us, and currently certainly working with Senator Pappas, Senator Housley, the researchers, Jenny Nash, Chelsea Axelson, nonpartisan staff that Representative Lee mentioned earlier, and I would like to very specifically mention Representative Lee for including me, even listening to me sometimes as we went through this process. I certainly did feel included through the whole thing. Not that all my suggestions for projects worked, but it was good to have the input. Now, in considering some of the conversation that we've had here, certainly, as I've said before, in a perfect world, and we were in control, we could have done a lot more with cash. And again, maybe not done any geo-bonding at all. A lot of the comments that have been made by some of the folks here were more actually aimed at the bill that passed previously than on this one. This geo bill, primarily geo, is basically the agency and the departments and their programs, far less local aligned projects, although there are some in here. But to address why is it so big this year. Well, again, we did no bonding bill the last biennium. None. And had we done it, would have been maybe $1 billion, maybe $1.1 billion, $2 billion, I don't know. And so now we're talking about 2.6. Well, 1.2, 1.2 is 2.4. Had we done one the last biennium, we wouldn't be far off from what is normally done. Now, this is a good bill. Perfect? No. As I say in my caucus, there'll never be a perfect bill because we have Democrats. Now, you might have a completely different way of phrasing that, but that's true to us. So why do we bond? To maintain the infrastructure and buildings of Minnesota, to take care of what we own, to return money to the people, and to hold down local taxes. Let me give just a little story about that. The small town that made a request to us called Lake Lillian. Lake Lillian only is about 270 people in greater Minnesota. About half the town's people are low income. 8% are below the federal poverty guideline level. Without the funding in this bill, they would still have to get a new wastewater system because their system was failing. They wanted help, and they're in the bill. But if they don't get that help, then they will have to pay for it themselves because they have a failing system. Local taxes, local property taxes would pay for it at an annual rate of $400 more per household for multiple years. Now, to a lot of folks in here, maybe $400 doesn't seem like a whole lot of money. But if you are living below the poverty line, $400 can be very important, very critical. And that's why we do this, to help those people in Minnesota who maybe can't help themselves. And that's why, at least, I try to do this. We bond, or in this case, pay cash as well, because it is our responsibility to meet the expectations of Minnesota to be stewards of this state. Our people, regardless of political persuasion, expect clean water and good roads. And capital investment is where it comes from largely in this state. This bill deals heavily with the needs of Minnesota. We addressed our colleges and universities and their building priorities. The Public Facilities Authority will have record amounts to ensure clean water and adequate wastewater facilities across our state. Most of my Republican colleagues' projects deal with water in one way or another. Local roads and bridges, critical to the movement of people and produce, receive a big boost. We have used more cash to pay for projects than ever before in state history, and that does make sense, especially with our surplus. And so, I thank those who worked so hard on this bill for so long and urge support.
The member from Dakota, the Vice Chair of the Capital Investment Committee, Representative Fryer.
Thank you, Madam Speaker. And first, I want to thank you for your staunch leadership in bringing us to this point. And I want to thank Chair Lee for your leadership of the committee. It's been an honor to be your Vice Chair. I've learned so much. To Lead Erdahl for your commitment to Minnesota and to the process. It's an honor to work with you as well. And of course, the staff, partisan and nonpartisan. I can't believe how hard you all work and how much you get done. Thank you. So I'm proud of these bills. They carry the stories from people of Minnesota heard in committees and 14 days of bonding tour. Project by project, community by community, we're making investments that help people live safe, healthy, and productive lives. We heard from our higher education students who learned despite the condition of the facilities of in their institutions, not because of it. For example, the chemistry students at the U of M, whose lab looks like something out of an old Frankenstein movie, and who can't work together as a group without going outside and sitting in the hall just to be able to have the group work that spurs innovation and learning. We saw the conditions that too many of our poorest Minnesotans live in. Many seniors and people with disabilities make their home in our public housing stock, which has been deteriorating due to lack of investment. We're providing $72 million to help people in public housing across the entire state. It's a record investment in this essential form of affordable housing. We saw crumbling water systems, facilities that are literally falling apart and are patched together from Gilbert to Mound to Mankato. We're making sure that communities have the facilities they need. Our veterans in Minnesota who serve their country to protect all of us, my son among them, asked us to be cared for and honored. This bill does that through providing dignified housing and community memorials. We're contributing to the day-to-day quality of life and building community connections with projects like inclusive playgrounds and replacing the very aged pool in Pelican Rapids, a project that captured many hearts through the investment they themselves were making for their kids. They were just needing a little more help. We all know that it makes better sense to take care of what we have rather than to build new. And that's why we're investing in asset preservation across our state agencies. The DNR, the Department of Corrections, the Minnesota Zoo, the Department of Human Services, and of course our higher education facilities, all are receiving needed resources. And we're investing in the safety of our roads and bridges. This is a bill that brings us together, from the Bedura Tree Nursery to trails across the state, from the National Loon Center to the St. Cloud Regional Airport, and from the Somali Museum to the Minnesota Military Museum at Camp Ripley, which you heard about from Representative Creshaw. We created a bill where all Minnesotans can see themselves. This is a bill that creates many good-paying jobs. It unlocks federal funds and brings economic opportunity for all our communities. This is an infrastructure package that focuses on justice and equity, as Chair Lee described, and that places a value on climate sustainability through programs like reforestation and the development processes that are put in place for the projects we fund. It's a bill we can all be proud of, and I ask you to vote green.
The member from Hennepin, the author of the bill, and the chair of the Capital Investment Committee, Representative Lee.
Thank you, members, and thank you, Madam Speaker, for this discussion on House File 669. And just want to say that today is a very historic day. It's been 3 years since we have a capital investment infrastructure bill. And so I just want to note for the record for Representative Dowd that when he was minority leader back in 2020, Chair Murphy did have an appropriations of $2 million for his community too. And so this won't be the first time. And so, members, as we hear the discussion today, talking about the cost to taxpayer, I think, just want to circle back into the conversation that Representative Erdahl brought forth with regards to our drinking water and clean water system. Without the investment that we have in this bill today, communities like the community of Borup in northern Minnesota will have to pay per household $1,555 per household for their water system. With the investment that we are making here today, that cost drops down to $606 per household, a saving of almost $1,000 for that community. And so I just want to let all of us know that the investment that we're making here, whether that's in local communities here in the metro area or in greater Minnesota, we are making a significant impact into everybody's lives, whether that's the road that we drive on, the drinking water that we have, or the community centers and the cultural centers that we have around the state. I think that's really important that we think about all communities having different needs across the state of Minnesota. And I'm just really excited. I just wanted to note some of the other items that we have in here. Representative Ryer already mentioned, public housing. This is the most significant opportunity that we have, put towards public housing across the entire state of Minnesota, where there's still a large need out there. We have heard from a lot of our housing authority that the need around public housing is roughly $500 million. And I want to bring us back to a tour that we have in Chair Hansen's district over at one of the public housing high-rise. When we look at that project, they literally were using duct tape to tape some of their pipes to make sure that the building could function. And so this is towards those vulnerable Minnesotans that are often left behind when we think about housing. And I already mentioned before, we have investment in here for individual projects, community projects that invest in shelters, emergency shelters for young people and for people of all background. I think it's really important for us to be grounded that the investment that we're making here today are going to have a significant impact into the future. We have significant investment in here into our two education systems, the University of Minnesota and Minnesota State. Whether that's through our current asset or investing in projects at individual schools. And the first time around in March, I mentioned Pine Tech. That is still one of the most memorable visit for me as chair of the committee when we visited Pine Tech and talked to some of the students and talked about how our individual impact is going to impact their local community, where they could actually have a body shop that serves as car for people with disabilities. And so, before I close, I just want to say again, thank you to all of our members of the committee, all of our staff, to the speaker for allowing me, this session to bring up two bonding bill, the first one in March and this one. Hopefully, this is the one that passed and gets signed into law. Thank you, Madam Speaker.
The clerk will take the roll on the bill. Members, please vote. The clerk will close the roll. There being 97 ayes and 35 nays, the bill is passed as amended by the Senate and its title agreed to. Introduction of House files. The following House files have been offered for introduction today. The Chief Clerk will report the House files and give them their first reading.
Introduction of first reading of House Files 3340 through 3342.
First reading House files 3340 through 3342. Motion at the desk.
Pursuant to Article 4, Section 19 of the Constitution of the State of Minnesota, Long moves that the rule therein be suspended and an urgency be declared, and that the rules of the House be so far suspended so that House File number 3342 be given its second and third readings and be placed upon its final passage.
Representative Long.
Thank you, Madam Speaker. That is my motion to allow us to take up our bipartisan agreement to help support our nursing homes.
Discussion on the motion to declare an urgency. The member from Stearns, Representative Damath.
Thank you, Madam Speaker. And members, I would encourage a green vote.
All those in favor of the motion, please say aye. Aye. Those opposed, please say no. The motion prevails.
Yes.
The clerk will give the bill its second reading.
Second reading, House File number 3342.
Second reading.
You can say the clerk will report the bill.
The clerk will report the bill.
I don't have the bill.
It's the last one.
House File number 3342, an act relating to human services.
I recognize the member from Hennepin, Representative Noor, to describe the bill.
Thank you, Madam Speaker and members. I know most of you have been waiting for this bill. This is one of the most important bills that we have before us today. Members, you have heard about the financial distress that nursing facilities are facing. We've heard from many of our colleagues come to us and say we have to do something about it. With the leadership of Madam Speaker, who really brought us together to make sure that we do something this session for the nursing facilities. We also know that the challenges that the hospitals are facing because they cannot discharge patients to a safe settings. Members, the bill before you is in addition to the work that we did in the Human Services Bill or budget. In that bill, as a reminder, we had $90 million for workforce incentives that will go to also to the nursing facilities. We had a $100 million loan program that will go to the nursing facilities on a 0% interest, 18 months delayed of payment with the terms decided by the department and also the nursing facilities. With this bill, Madam Speaker and members, we're providing additional workforce incentive program only for the nursing facilities of $75 million. That means the nursing facilities will be able to provide bonuses. They'll be able to provide incentives for their workers of up to $3,000 per employee per year. Those employees who are making less than $30 per hour will be able to receive that funding. They can use it for housing, for childcare, for other needs that are necessary to support the workers. This will help with the recruitment and retention of employees in the nursing facilities. Madam Speaker and members, within this bill, we're providing $173 million payments of $225,000 to each facility in the state of Minnesota. And then the remainder will be divided based on the number of active beds for that nursing facilities. This funding will go out effective August 1, 2023 for the first payment, and then the second payment will be August 1, 2024. Members of Madam Speaker, the payment will be more specific rather than items that will increase the VBR. And if there is any increase based on the projected focus, that means there will be clawback for all the nursing facilities. Madam Speaker and members, we also have a small rate temporary increase of $12.35, which is $51 million. This will add the rates for 18 months effective July 1, 2023, up to December 31, 2024. Members, this $51 million with the addition of private pay and also the federal matching dollars, which is under the UPL, which is the upper payment limit. We're able to leverage $134 million for the nursing facilities. Members, this is a great opportunity for us to address the needs of our seniors, and this is a great bill, and I ask for you all to support this bill and vote green.
Discussion to the bill. The member from Rock, Representative Schumacher.
Thank you, Madam Speaker and members, and I would rise in support of this bill. It's interesting to get this put together. I heard a lot of complaints about the way that the VBR system was set up for nursing home funding over the last few days. I think it's just really conservative of the legislature at that time to put legislation together that makes it so hard to add new money into a program like that that's supposed to be running on its own. Members, the value-based reimbursement program for nursing homes works as long as there's not a worldwide pandemic or epidemic or anything like that to try and deal with. When nursing homes were faced with keeping their doors closed, with only allowing certain people in all the time, when having the National Guard in their parking lot in order to check the COVID status of nurses before they came in and out of the facility, it caused a lot of excess work, a lot of burnout in the process. You couple that with the great resignation that we have and just the overall overbearing work that our care providers offer, this starts to become inevitable. This process caused by a pandemic meant that a lot of facilities had trouble bringing in new residents to help cover their bottom line as they provide care, and so then they have to restrict hours or hire pool nurses to cover, and pool nurses come in at 2 or 3 times the charge of what an in-home, what a local nurse would have for that. And so nursing homes had to do what they had to do, which was drain their reserves and take out lines of credit in order to pay people to keep the doors open as well as they could. And that creates problems with what we are seeing today, and that's what they're trying to alleviate with this program. So what we'll see here with this is that in the first 2 years especially, money will be put in with a baseline rate increase as well as some other other funding mechanisms to help with that so that they can really get back up and start hiring nurses that they can afford to have in-house instead of taking the pool nurses, being able to pay off some of those lines so they have a little bit more breathing room in their operating costs and the cash flow issues that they've faced, and really is a good way. We were able to get something bipartisan put together. I will say it was a whole lot easier to work with House and Senate Democrats than it was with the department, and so I have a new appreciation for the people in this chamber after the last few days putting this together. And so with that, members, I would ask for your support. Thank you.
There is an amendment at the desk. The clerk will report the amendment.
Noor moves to amend House File Number 3342. The amendment is coded A1.
Representative Noor.
Thank you, Madam Speaker and members. I think I described a little bit about the hospital decompression issues, where patients are still in the hospital when they should be discharged. So this amendment provides $18 million for the fiscal year 2024 so that the hospitals can be reimbursed for up to $1,400 for partial reimbursement for qualifying avoidable patient days. So this is to help the hospitals address the discharge issues that they're facing. I ask you to support the amendment.
Any discussion to the amendment? Seeing none, all those in favor, please say aye. Aye. Those opposed, please say no. The motion prevails. The amendment is adopted. There are no further amendments at the desk. The clerk will give the bill its third reading.
Third reading, House File Number 3342, as amended.
Third reading as amended. Discussion to the bill. The member from Polk, Representative Keel.
Thank you, Madam Speaker. Wow. It took us 4 months to get this done. When I entered the legislative session in January, I knew that I had at least one nursing home hanging on the edge. So when I tried to work with powers that be, had conversations with Representative Noor, Chair Noor, Chair Fisher. We had conversations about it with the department more than once. You know, I didn't want to make public that my nursing homes may fail, but for the fear that they would lose even more employees. There was high competition in Polk County as far as the workers, because they were offered other jobs. DigiKey, you heard about, offered them benefits as well, really good benefits, as well as a better pay per hour. And so that's why this was so imperative that we help our nursing homes. They were hanging by an edge. One of them is really going to hope to open up again. I don't know as that will happen. But my fear in rural Minnesota, especially up in our district, I don't know the detailed numbers, but we're a highly large baby boomer area. And so while we have PCAs and we have home care, many of my seniors don't necessarily have homes that will provide for the care they would need in a nursing home type setting. So I thank you, Representative Noor, and everyone who worked together to get this done. This was super, super important. I don't have highly profitable nursing homes anywhere in the area. They are all very, very challenged. More than one of them had, I'm hoping this will help the one that had National Guard, like Representative Schumacher said. They were literally in the building trying to help out the nurses because the nurses were sick and they just didn't have anyone to take care of the residents that had COVID. As we talked about, it was high pay, 3 times the amount that a CNA or an RN was hired to do because of the nurses that we brought into the district. This has been going on long before COVID. We were having that challenge already. So I am so thankful that we are doing this. I would hope that in the future we think about nursing homes. You know, I would encourage all of you members, go visit your nursing homes. I have visited down here. There are some fantastic nursing homes that have quite a bit of opportunity. I'm not sure I can afford to stay in them because they are a different setting. However, they're so important. And March 17th, I probably have said this, but March 17th, my life changed. Now, I was thankful because I didn't need hospitalization for days. I could stay 24 hours and go home. But the reality is, I likely could have had those problems. And, you know, going to the nursing home in my district means rehab as well as just the care, so that as I rehab or as someone rehabs to be able to be independent and go home, this is part of the necessity of keeping these nursing homes open. Having the hospital funding, Representative Noor, helps us to make sure that a family can not have to move their family member more than once. It is extremely traumatic when you're leaving the hospital to have to go to the nursing home, and I would hate to tell somebody, oh, by the way, you're going to have to go to this room, and then we'll have to move you here because of the staffing that needs to happen. So it helps them to plan, know what's going on, but this is a super important. I'm just thrilled that we're doing this. This is so important. It helps our rural Minnesota. I believe it does in the cities. The nursing homes are really in need of help. I'm glad we're going to educate, encourage, so that we have more nurses on staff, so that there'll be that opportunity. I hope we encourage some high school students to think about it. You know, I'm old enough, I had a career in tech classes. I didn't take the nursing classes. But in my district, we have one retired doctor already. We have many nurses that work in different services, but all of them started their junior year of high school. And they learned all kinds of things, and then they went to college for a 10-month course out of the University of Minnesota Crookston, and then were able to work in the system. So it is just very important, and I would thank the members. I really encourage you to vote green, and thank Speaker Hortman for getting us to get this done. Thank you.
The member from Chisago, Representative New Brindley.
Thank you, Madam Speaker and members. And the first thing I want to do is thank Chair Noor. We had some very honest conversations, I think, early on about certainly our commitment to fund nursing homes, and you were honest with us about trying to find the money. Thank you for finding the money. So I think it is worth talking just for a minute about how we got here, because it is a cautionary tale to ensure that we don't get here again. It has been shocking to see the unwillingness of the governor's administration of DHS to put any funding into nursing homes. Shocking. Frankly, at the 11th hour, they're still trying to tell us why we just couldn't do it. And I think I know why, but I'm not entirely positive. But thank you to Rep. Schumacher. We put into place several years ago something called value-based reimbursement. And what that means is that nursing homes are actually reimbursed for their actual expenses. They're reimbursed for what it costs to run their nursing homes. The problem we run into is that there is an almost 2-year delay on those reimbursement rates catching up. So when you run into a situation like we've had over the last couple of years, where nursing homes incurred massive costs during the COVID pandemic, where we have had massive, in fact, historic, we've had the largest inflation in our country's history, nursing homes are being reimbursed based on rates from 2 years ago while paying the costs of today. You can imagine that this creates enormous holes in budgets that cannot be filled. On top of that, I believe Minnesota is the only state, I'm sure my staff will correct me if I'm wrong, that does this equalization with nursing homes. We do not allow nursing homes to charge more for private payers than Medicare payers. They are not allowed to charge any more money to people who are private payers. Now, this does not apply to all of our other systems. Assisted livings are not bound by that. So there may be different reimbursement rates in assisted living. Group homes, this doesn't apply to group homes. There may be different reimbursement rates or charges in group homes. And so these other areas of our healthcare system are able to make up some of those costs. In fact, we talked about this a little earlier when it comes to Minnesota Care. Actual costs here, Minnesota Care pays here, Medicaid pays here. Here are the actual costs, private insurers pay here. In our health systems, that applies. Like I said, in assisted livings, this might be the real cost. Medicare may pay here, or state programs may pay here, but private payers might pay here to make up those costs, to keep them solvent. Nursing homes do not have that same ability. In the state of Minnesota, we say that nursing homes must be equalized. They can't charge more to a private payer. So they don't have a mechanism to make up for the holes that are created when they're being reimbursed based on the costs from 2 years ago. They don't have a mechanism to make that up, which is why, it was shocking. Just last night as we're having this conversation, Someone from DHS said, well, as we're talking about how we could possibly use this $300 million, he said, well, aren't the nursing homes finding the cash to pay for these things somewhere else right now? Well, some of them are, but mostly nursing homes are taking out loans, and they are now over-leveraged. We had this conversation the other day, so they can't take out more loans, or they're closing their doors. They're not just finding the money someplace else. The money really does not exist. The money really does not exist. And nursing homes have been closing their doors. So thank you, Chair Noor, for your work in making sure that this was the final result. Because there were lots of things presented that still would not have worked for our nursing homes. But the bill before us tonight, this bill is going to go a long way to taking care of our senior citizens, and not just any senior citizens, the most vulnerable. This bill is going to go a long way towards taking care of those senior citizens who can't be cared for by the people who would so desperately like to do so. Their families just are not able to meet their needs. They need long-term care facilities, and this bill is going to do that. This is some of the best money we've spent all session, and I am assuming, I'm hoping, that we're going to see 134 green votes on this funding tonight to take care of our senior citizens. Thank you.
I recognize the member from Morrison, Representative Schultz.
Thank you, Mr. Speaker and members for this bill. I'm excited. I maybe counted up the number of times that I've been able to vote green on a bill that allocates an amount of money this year, and I think that this would be bill number 5 for me this year. And I'm excited about it because it has the right place priorities. We are finally bringing some fairness to the folks in my district and in communities across the state, especially as it relates to our aging community. One of the early tours that I did this session after being elected, once I was sworn in, I should say, was to one of the nursing facilities and aging communities in my district. And what I can tell you is I'm incredibly proud and grateful for the people who go to work every day in those facilities, caring for our most aging members of our community, our loved ones. And many of you know I come from an exceedingly small town. And in the last 2 years, we built and opened a brand new nursing facility in my town, my hometown, of 487 people. And I'm excited that a bill like this will provide for additional support for the numerous aging communities in my district. So I'm excited to vote yes. Thank you so much to the members who helped make this happen, and especially our Republican leaders who stood strong to ensure that we were providing this funding to support our seniors.
Further discussion on the passage of House File 3342. I recognize the member from St. Louis, Representative Zalesnikar.
Thank you, Mr. Speaker, and I just want to thank Representative Noor. He knows how passionate I am. I know Representative Hussein does too. We've had conversations, and to my colleagues on this side and to our minority leader and Speaker Hortman, who worked with the majority in the Senate and the leadership there, to really hear the voices after a bill was passed Friday night that was really a great bill, but I wasn't able to vote yes for it because of what was missing, not because of what was in it, but because of what wasn't in it. So on behalf of the seniors that are in 300 nursing homes, while I haven't ran a 24-hour facility for almost 3 years, and I haven't been a nursing home administrator since running an operation in that setting since 2001, I did it for 10 years. I think it's really important that you all know you made a difference. This will make a difference. And the nursing home administrators and the staff and your family members are going to see a lifeline that's really, really critical for Minnesota nursing homes. And I'm committed to help work on policy and reimburse working with DHS to try to fix this, because we have the biggest group coming through, the baby boomers, and we have to get it right. So it's a Band-Aid, but it was a really critical one. And so I just want to tell you thank you for your leadership and a bipartisan effort for the frailest of the frail that are in Minnesota nursing homes, and for the staff that have stood by them all through some really tough years. So thank you for doing what's right for Minnesota. I'll be voting yes.
Further discussion. I recognize the member from Douglas, Representative Franzen.
Thank you, Mr. Speaker and members. I just want to thank the nursing home facilities for sticking with us during this session. There was a lot of emotion going on, a lot of emails, a lot of phone conversations, and they did not give up in the legislature, making sure that we did the right thing. So members, when you press that green button today, I want you to be proud and know that your nursing homes are supporting today's measure, although in my opinion, it should have probably been done months ago. But personally, myself, my nursing homes have been reaching out to me when the news hit that this bill was coming forward. So just thanks to the nursing homes for believing in the legislature that we would do the right thing. Thank you.
Further discussion. I recognize the author of the bill, the member from Hennepin, Representative Noor. I recognize the member from Brown, Representative Torkelson.
Thank you, Mr. Speaker. Everything has an order to it. The previous person in the chair had noticed me, so apparently she didn't write me down. Members, I'm thrilled that this bill has come to us finally, and I thank Chair Noor for his work for the most elderly, most vulnerable citizens in our state. I don't understand how the administration can have such opposition to this very important funding. It boggles my mind. So I stand here, I'm happy and disappointed at the same time. Honestly, this should have been one of the first bills that this body passed. This is a crisis. It's been a crisis since before we got here, and we've failed to address it until the last possible moment. That's a shame. It's a shame that this has become a political football, that we've made our elderly, the elderly that are near the end of their lives in their nursing homes, being cared for by some of the most wonderful people in this state, and we have made them the last priority. And we've allowed ourselves to make them a political football of this process. It's a dirty shame. This should be a #1 priority, and I hope that going forward as we go into the next session, into the next biennium, that we examine our priorities and understand that it's just not right. It's just not right to put these people at the bottom of the list. Please vote green on this bill.
For the discussion, I recognize the member from Ramsey, Representative Hussein.
Thank you, Chair Noor, for bringing and working and dedicating for this. I do have a lot of facility in my district as well, and this is a great investment for all of us in the nursing. And this will be our next step when we all grow up, and we need to take care of those ones that's in a nursing home right now. And this is the best we could do, and Chair Noor has worked hard day and night to take care of those nursing. And I do have a few family member who's in nursing home right now, and those nurses take care of them really hard. And this is the best investment that we could do. And thank you for doing this, Chair Noor, and please vote green and protect for those nurses.
Further discussion to the passage of House File 3342. I recognize the member from Stearns, the Minority Leader, Representative Damath.
Thank you, Mr. Speaker. And members, I believe that we would have actually addressed the nursing home funding crisis right away when session started. We knew that nursing homes were facing such a need, and it could have been done right away. When we realized that it wasn't being taken care of on our side of the aisle, we set up a working group to look a little bit deeper into the issue and look for solutions. Then on January 20th, the 4 leaders met at the governor's residence, and this was a topic of conversation that came up. And we said, could we possibly look at this before the end of session? And it seemed like there could be some type of an agreement. And so we went ahead and expected something to happen, even to have gone as far as declaring an urgency. That didn't happen. And so we invited members of our working group, the agency, members from the governor's office to come in and address the issue, and still nothing happened. I am very, very grateful for the $300 million that is coming late in session, later than we would have anticipated, but very grateful that it is happening for our nursing homes, the ones that are caring for the most vulnerable in our state. I'm appreciative to the work that was done on language that wouldn't have hampered the nursing homes to use this, to members from each one of our caucuses that gathered together and worked and beat out language that would actually work. As we have seen in the bills before us, the little bit of nursing home funding would actually be a loan and put them in a more difficult position. This is good language, better late than never. Vote green.
The member from Hennepin, the author of the bill, Representative Noor.
Madam Speaker, thank you so much for entrusting me to really address this issue. Human services is one of the most complicated areas. And when you add the value-based reimbursement, it even gets more complicated. You will need to have a deep dive into how the cost rating is set up. And it's great to understand there are individuals who were there when the VBR program, like Schumacher, who was leading that effort, to be in the room. I just wanted to thank also Chair Fisher, New Brindley, I represent New Brindley, in structuring this program. Members, as we talked before, there's $853 million already baked in the VBR focused aid program. On top of that, we added $100 million that will be available until 2029, which is a 0% interest, 18 months no payment added on top of that. We also have $90 million in the previous bill that provides workforce incentive for the nursing facilities that is included in there. And in this bill, as I described before, we have $173 or $174 million that will be distributed to the nursing facilities across the state. That will be available for the next 2 years as we look into and study the VBR program. Then also we have the daily rates increase of $51 million in this bill, and that turns out to be $134 million combined with the federal reimbursement and the private pay. And finally, an additional $75 million that will go to the nursing facilities workforce investment. This is a huge investment. This is a significant investment. Unlike any other group that we have funded, this is an investment that is much needed today. We are supporting the grandma and grandpas who need that help. We're supporting our nursing facilities collectively today. This would not have been done if we had not continued to have the conversation. By bringing people together from both sides and also the department and working with the advocates, we were able to land this ship. We were able to do this work together. Members, for the last time on this floor, as I speak to you for this session, LFG, let's vote green.
The clerk will take the roll on the bill. The clerk will close the roll. There being 132 ayes and 0 nays, the bill is passed as amended and its title agreed to. Everybody's been so naughty, you can applaud. Representative Long. Oh, wait a second. Messages from the Senate.
Message from the Senate, Madam Speaker. I hereby announce the adoption by the Senate of the following Senate concurrent resolution herewith transmitted. Senate concurrent resolution number 7 relating to adjournment of the House of Representatives and Senate until 2024. The message is signed Thomas S. Boddern, Secretary of the Senate. Long moves that the rules be so far suspended so that Senate concurrent resolution number 7 be now considered and placed upon its adoption.
Representative Long.
Thank you, Madam Speaker. The Senate didn't want to get out here on Thursday, so they sent this back over to us. So we're going to be adjourning today and coming back on February 12th, 2024.
Discussion to the motion by Representative Long. Representative Demuth.
Thank you, Madam Speaker and members. This is a good resolution, and I would encourage a green vote.
On the rules suspension, all those in favor, please say aye. Those opposed, please say no. The motion prevails.
Long moves that Senate concurrent resolution number 7 be now adopted.
Representative Long.
I encourage members to support it.
Any further discussion? Seeing none, do we?
No.
All those in favor, please say aye. Those opposed, please say no. The motion prevails. Senate concurrent resolution number 7 is adopted.
I'll read a sentence and you can say the copy has been on. Okay.
Report from the Committee on Rules and Legislative Administration.
The Journal Resolution. Be it resolved by the House of Representatives of the State of Minnesota that the Chief Clerk is directed to correct and approve the Journal of the House to the last day of the 2023 regular session.
Copy of this order of business is on your desk. Representative Long.
Madam Speaker, this is the resolution that allows the Chief Clerk to correct and approve the Journal of the House.
Discussion on the Journal resolution. Seeing none, all those in favor, please say aye.
Aye.
Those opposed, please say no. The motion prevails.
Report from the Committee on Rules and Legislative Administration. Be it resolved by the House of Representatives of the State of Minnesota that it retains the use of parking lots.
Copy of this order of business is on your desk. Representative Long.
Madam Speaker, this is the parking resolution.
Any discussion? Seeing none, all those in favor, please say aye.
Aye.
Those opposed, please say no. The motion prevails. The resolution on parking is adopted.
Report from the Committee on Rules and Legislative Administration. Be it resolved by the House of Representatives of the State of Minnesota that during the time between the adjournment in 2023 and the convening of the House in 2024, the Chief Clerk and Chief Sergeant, under the direction of the Speaker, shall maintain House facilities.
Copy of this is on your desk. Representative Long.
Madam Speaker, this is what lets kids come to the Capitol while we're gone.
Any discussion about letting kids come to the Capitol while we're gone? All those in favor of the motion, please say aye. Those opposed, please say no. The motion prevails. The resolution is adopted. I know you all think we're done, but there's more to come, so don't back up too much. Representative, is there anything else? Representative Long.
Madam Speaker, I move a recess to the call of the Speaker and note that it will be approximately 2 hours or a little bit more, and we will give members a 30-minute notice until we reconvene.
Representative Damath.
Thank you, Madam Speaker. Republican members, we will be caucusing immediately at recess in 112.
Seeing no further discussion, all those in favor of the motion to recess, please say aye. Those opposed, please say no. The motion prevails. The House is in recess.